Bore da, a chroeso cynnes iawn i'n cyfarfod heddiw, sef cyfarfod Bwrdd Iechyd Addysgu Powys. Ac fel y gwelwch chi, fe gynhelir y cyfarfod y bore yma yn rhithiol, a mae'r cyfarfod hefyd yn cael ei ffrydio yn fyw ar wefan y Bwrdd Iechyd. Yn ogystal, mi fydd na recordiad o'r cyfarfod ar gael ar ein gwefan yn dilyn y digwyddiad y bore yma i bobl cael gwylio y cyfarfod yn eu hamser nhw eu hunain. So a very, very good morning to each and every one of you, colleagues who are present and participating in this meeting this morning, a meeting of the Powys Teaching Health Board. As you can see, we are holding the meeting virtually, and so a warm welcome to any who may be watching this morning, and indeed to those who will access the recording of the meeting, which will be available on our website following the meeting today. And also, just to say that this is being live streamed, and so it is available to the public and a public meeting. Cael cwpr y dwi a fi ydi cadeirydd y bwrdd iechyd fel petai, ac ar y sgrin ar hyn o bryd, fe welwch chi enwau ynghydweithwyr bwrdd, sef yr aelodau undebol a'r aelodau gweithredol. Our board is made up of both independent members and executive members, and together we form the unitary board, the governing body of Powys Teaching Health Board. And also, you'll see our names on the slide which is on your screen currently. Also on your screen are names of those who are not board members but will be contributing to our meeting today, together with the names of colleagues who can't be with us today and whose apologies for absence we have accepted. Ac felly, pam dyn ni yma? Pam dyn ni'n bodoli fel bwrdd, ynde? Wel, ein cyfrifoldeb ni fel y corff llywodraethol ydy gosod cyfeiriad strategol ar gyfer y sefydliad. Dyn ni'n gyfrifol hefyd am osod archwaith risg yn gysylltiedig â'n hamcanion strategol. Dyn ni'n gyfrifol am graffu ar berfformiad y sefydliad yn gysylltiedig â'r amcanion strategol hynny, ac hefyd i ddatblygu a lliwio diwylliant y sefydliad. Hynny yw, sicrhau bod ni yn ffocysu ar sut dyn ni'n gwneud pethau ac nid yn unig ar beth dyn ni'n gwneud. So our responsibility as the governing body of Powys Teaching Health Board is essentially fourfold. We're here to set the strategic direction for the organisation, to set the risk appetite in relation to our strategic priorities, to monitor performance and delivery against those strategic aims, but also, and very importantly, to shape and to develop the culture and tone of the organisation. And it's very important to us that we focus on the how we do things as well as what we do and how well we do. So that essentially is why we're here. Fe welwch chi ar ein gwefan yr agenda a'r papurau ar gyfer heddiw, felly dwi ddim yn mynd I fynd trwyddyn nhw yn fanwl fan hyn, ond yn sicr, os oes gennych chi diddordeb, ewch i'n gwefan ac fe gewch chi o hyd fyna i'r papurau ar gyfer y cyfarfod. The agenda and papers for today's meeting are available on our website, so please do go there and so that you can follow the content of our business as it's transacted this morning. You'll also see on our agenda that we have a relatively new section called the consent agenda, and it'll be pretty self-explanatory when we come to it, but essentially those are items that we think are not controversial and the contents of which we generally approve, and therefore those particular items will be approved en bloc we note them, we receive them, and so on. But as I say, that will explain itself when we come to it. We will be taking some breaks during the meeting, and notice of that will be displayed on the screen. And so just before we get into the business proper, very sadly, I do want to start on an upsetting note, really, in that one of our recently retired independent members, Tony Thomas, has died, and his funeral is to be held tomorrow. Tony was a very dear friend within Powys Teaching Health Board. His contribution and his colleagueship was greatly valued, and in particular, the way in which he helped us to strengthen and develop in a very significant way our Audit and Risk Committee. And as the independent member for finance, the way in which he helped us to do our business more effectively in relation to the scrutiny of financial matters. We will miss him very much, and we've been in touch with his family, and we certainly extend to them our ongoing best wishes, support and friendship. On a much happier note, I'm really pleased that we're joined today by Joy Garfitt, who is with us after a period of ill health, so it's really good to see Joy back with us today, and also a very warm welcome to Steve Elliott, who is our new independent member for finance. And Steve, we very much look forward to your contribution to our meeting and to the business of our board. I know that you will bring many skills from your very distinguished career in finance and in health finance. So a very warm welcome to you. And so we go to the business proper, and initially to the declarations of interest. Does anyone want to declare any interest in relation to any item on the agenda today? No? Okay, so I've just received a message to say that some of the information I've just shared isn't quite correct. So let me correct that before we proceed. Joy Garfitt, I'm really pleased to say, is well enough and is back to work. So that's the really happy message. She isn't with us today, and David Farnsworth, who is the interim director, is with us. Please forgive me. I had understood that she'd be with us today, and clearly that was not right. So I'm happy to correct that. And so we go now to the board action log, item 1.3 on the agenda. There is only one action on the action log, and that's completed. I'll just pause just in case there is any comment or any contribution from anyone in relation to that completed action. No, in which case we go now to item 1.4, and as a standing item on our meetings, we hear from patients and staff about their experience within Powys Teaching Health Board. And so I'm going to hand over now to Deb, our Executive Director of Workforce at OD, who will introduce Jill Griffiths to us and this item on our agenda. So thank you, Deb.
Thank you, Chair. Borodar, good morning. Deborah Wood-Lawson. Carl's already given the title. Delighted to welcome Jill with us today. Jill and I caught up yesterday, so really excited for everybody to hear of the journey, the career journey that Jill has had, and the attendance and the benefit that has been gained from attending the Clinical Leadership Immersive Programme, often called CLIP, for anybody that has seen that kind of shorthand version for it. And just for everyone to know that the CLIP programme we first launched in the Health Board in December, and Jill was one of the first participants. So I won't steal any more thunder, Jill. I'll hand over to you. Thank you.
Hello, good morning everybody. My name is Jill and I work with the palliative team in South Powys. Slide 2, please. I commenced my RGN training in Hereford in 1987. I wanted a job career that provided variety, working with people and supporting people. I worked and enjoyed the busy trauma orthopaedic unit. I returned to Powys in 1995 and was lucky to work with a fantastic team leader in my early community nursing years, and enjoyed nursing people within their own homes and found an interest in palliative care. During this time, I undertook various qualifications and was fortunate enough to have placements with the district nurse qualification in Boston in New Hampshire. Sorry, could you go back to slide 2? Sorry. And represented Powys Teaching Health Board and 5 other colleagues for International Nurses Day at Highgrove. A further highlight was being part of a trio that provided teaching in Romania on community nursing aspects. My interest in palliative care remained, and I aim to continue my nursing career. Slide 3, please. A palliative ethos is about what matters to the patient and family, and supports priorities of care, providing holistic symptom control to patients and our families in Powys. In 2005, I obtained a secondment with a specialist palliative care team in Powys. From there, in 2006, I worked with the Mid Palliative Care team and latterly South Powys Palliative Care team. My learning and development continued through this time. In 2008, I undertook a BSc and obtained first-class honours in palliative care, and further courses as non-medical prescribing and my MSc in 2023. More recently, I have undertaken the CLIP programme of 2023 and 2024. I've always enjoyed supporting and providing learning to those that deliver palliative care within Powys, and have supported learning over the years by providing support on the palliative care degree module with the University of South Wales in 2014, 16 and 18. I've also done some in-house bite-sized education. But more recently, and as part of my time on the CLIP project, I've developed a palliative care 5 days fundamentals for qualified staff, and also more recently a 2-day healthcare support worker programme for our healthcare support workers. And I hope that these will, and they are running biannually, and to be a rolling programme going forward. Next slide, please. The Clinical Leadership Immersive Programme, known as CLIP, has inspired and reframed my vision on supporting education within Powys Teaching Health Board and ensuring education is evaluated and available to all who deliver palliative care, which has led to the healthcare support worker programme being delivered. CLIP has enabled me to reflect upon how I can enhance my role as a clinical leader, how to support the wider MDT that deliver palliative care within our circle of influences to aim for positive outcomes. That develops a growth mindset when delivering equitable palliative care within Powys Teaching Health Board. The patient and family are centred to this, ensuring their priorities of care and what matters are at our forefront of our minds, so that they can be within their preferred place of death at their end of life care. Holistic symptom control is also our gold standard, and priorities of care that are the family's needs must be met. So within this, as a specialist palliative care team, we are accountable practitioners, and our aim is to help and support the supportive palliative care team that deliver palliative care to the wider families and patients within Powys. We do this by education, being visible and promoting that psychological safety for a growth mindset, and to support and motivate and empower the wider MDT. So as a clinical nurse specialist in palliative care, our aim is to enhance the provision of palliative care services within Powys Teaching Health Board, ensuring people are cared for in their place of choice during their disease trajectory and into end-of-life care. Last slide, please. And in summary, our vision for ensuring effective and equitable palliative and supportive end-of-life care in Powys must be built upon the focus that how people die remains in the memory of those who live on. Thank you.
Jill, thank you so much. I'm just going to invite Deb. Deb, I don't know whether you have any additional observations or reflections following Jill's very impressive presentation, but please come in if you do.
Okay, thanks, Carl. It is an impressive presentation. All of the participants in the programme were very kind of uplifted and energised by this presentation when Jill gave it. So I'm really delighted that Jill was able to share some of her time today and describe that journey. And I think it's a big thank you to you, Jill, for your passion and your dedication. This is clearly a really important area of work. And, you know, I'm sure our communities, patients, their families and our staff will benefit from you bringing your expertise and really engaging in education and development of others. So thank you. I'll hand back to you.
Thank you. And Claire Roche, our Executive Director for Nursing, would also like to contribute. So thank you, Claire.
Jill, thank you, Carl. Jill, lovely to see you again. I had the pleasure of being at the recent event where you and other colleagues gave your presentations, and the energy in the room was both palpable and infectious. So thank you so much. I just wanted to comment that, you know, having seen the presentation again, for me, it really is a great example of demonstrating what really matters to us as nurses in our code of conduct. And the 4 Ps are prioritise people, preserve safety, practice effectively and promote professionalism. And not only does that presentation in terms of its content demonstrate that, but you demonstrate that in terms of the way you present it. So thank you very much. And as ever, thank you for the work that you do. Diolch, Carl.
Thank you. And just finally, from me, Jill, I've been delighted during my time in this role to spend a little time with you colleagues and the palliative care team, and glimpsed a little bit of both the significance of your work and the positive impact it has. And your being with us today just helps us to humanise the information and the data and so on that comes to us as a board. And so thank you very, very much for that. We don't open this for discussion, but I do want to assure you that it really helps us in our conversations. And certainly I look forward, and I'm sure other colleagues will as well, to being with you again when those opportunities present themselves. So, but for this morning, thank you very, very much.
Thank you. You're welcome. Thank you.
Felly, symudwn ni ymlaen rwan at eitem 1.5 yr agenda, ac fel dyn ni'n gwneud mhob cyfarfod, dyn ni yn gwahodd aelodau o'r cyhoedd os dyn nhw'n dymuno i roi cwestiynau mewn i ni. At every board meeting, we provide an opportunity for members of the public to send in questions that we will then consider and respond to. We have had one question for this meeting, and as well as an oral response that will be given by David Farnsworth, a written response will also be provided to this questionnaire. So the question is, how does Powys Teaching Health Board plan to improve provision of services for patients living with Parkinson's disease in North Powys, including initial assessment wait times and ongoing support via specialist consultants and dedicated Parkinson's nurses. Thank you, David.
Thank you, Chair. And from in response to the question, following an extended period of absence for the practitioner in the north of the county, a new person was appointed to the role of Parkinson's nurse back in August last year, specifically covering the geography of the north. That's obviously resulted in a significant improvement in activity and performance of that service, with an average of around 75 appointments a month between October last year and March this year. In addition, a consultant from Shrewsbury and Telford, Dr. Thompson, has been commissioned to increase the numbers of consultant clinics. That's up from 6 to 10 a year now. And it's also worth noting that the Health Board are working with Parkinson's UK to explore our funding and to see whether funding that's available in October of this year might also provide for a further Band 6 role. I guess finally, just to confirm, the service doesn't operate a waiting list and all new referrals are offered an appointment within a couple of weeks. Hopefully that should fully answer the question that was posed. Thank you, Chair.
No, thank you, David, for that helpful response. And just to repeat what I just said, we will respond directly and individually as well to the questioner. And thank you very much for the question, valued and welcome. We turn now to the updates, initially from me. I'm going to take my report as read, but I'm very happy to either respond to questions or enter into conversation about any aspect of the report. Does anyone want to contribute at this stage? I can't see anyone wanting to, so, Robert, please.
Thank you, Chair. Robert Lewis, independent member. I'm just picking up, Carl, on the reducing waste workshop that you attended. Obviously, up to 20% waste could mean lots of things, but I just didn't want to lose that really. And I was wondering how the board could be involved in observing the efforts that we make to contribute to reducing waste, bearing in mind that, you know, even 5% of a big number is still worth doing. Thank you.
Thank you, Robert. I know that Hayley has been giving some consideration to how we use the learning from that workshop. And Hayley, you also, along with some exec colleagues, were at the workshop. So perhaps you'd like to come in.
Yeah, thank you. Thank you for the question, Robert. I think there's a lot in that session that we attended, that masterclass. It was very, very helpful. But I was actually quite pleased in many ways because a lot of the work that was shared there already forms part of our thinking, both around the work that we're doing as part of our current plan to drive efficiency and productivity across services, but also to with our value-based approach around some of the changes we're taking. However, I think there is something for us about how we draw attention to that, to the committee and to the board under the guise of waste. And I think that language we haven't been using quite as strongly as probably we could and should. I also think it was really interesting around the point about asking particularly frontline staff and other members of the team where they can see waste and how they can see improvements. And there's a piece of work at the moment we've started, which is about business process improvements, which will again identify further actions around that. But clearly we need to report that through to the relevant committee and board to give you that further assurance as we move forward. Thank
you, Helen. Do you have any thoughts as to which particular committee or committees that this information could be considered by?
Yeah, thank you, Carl. Helen Bushnell, Director of Corporate Governance. That would fall under the remit of the Delivery and Performance Committee. So I'll speak with Ronnie and we'll start to schedule that in.
Thank you. Thank you, Robert. If there are no other questions, we move to the Vice Chair's report and to Kirsty. Thank you, Kirsty.
Thank you, Chair. Good morning, everybody. Kirsty Williams, Vice Chair of Powys Teaching Health Board. I will take the report as read, and I'm very happy to answer any queries or questions that colleagues have.
Does anyone want to ask anything or contribute? No, so thank you, Kirsty, for the report. Appreciated. And we turn now to our Chief Executive report and to Hayley. Thanks, Hayley.
Yeah, thank you. So I take the majority of the report as read. However, in the report, you'll see that in particular, there's reference under the EMIS Welshire Ambulance of a meeting that took place only yesterday of the Joint Commissioning Committee. And the timetable is set out to work out the content of the bespoke road-based model, and when that comes back to the committee for final approval in October was agreed yesterday in the committee meeting. So we will ensure, and I know we're having discussions at the moment to make sure that we form a really clear part and contributions are made to the task and finish group and the technical subgroup that will support that work being undertaken. So that's additional information from yesterday's meeting, that all of that work has now been approved and the timetable, and we're seeking further information regarding the terms of reference and just the scope of that work going forward. And then the final thing, I just had to mention the Long Service Awards. I know many board members and staff members were involved in this, but it was such an honour to be a part of a celebrating event with all of our colleagues who have worked within the NHS for over 30 years, and a very fine colleague in Powys, over 52 years service. So it was such a humbling event and lots to learn and just a wonderful celebration. Thank you.
Thank you, Hayley. Ronnie, please come in.
Thank you, Chair. Hayley, as always, a very helpful report. I wonder if I might just pick up 2 points quickly, please. In relation to the spring COVID vaccination, I think the age cohorts are essentially the same as they were for this last year. But my recollection is there was some evidence of vaccine fatigue. And I just wondered if there is any evidence of vaccine fatigue in relation to the spring programme this year. And then my second question, and you won't be surprised about this really, is in relation to the Wales Air Ambulance. And my concern that all of this seems quite an ambitious timescale. I'm sure it's deliverable, but it is ambitious. And what concerns me particularly is the clinical aspect of this, and to ensure that we are fully across that, and that we are adequately represented in relation to the clinical dimension. And I'm sure you will understand my reasons for mentioning that. Thank you.
Thank you, Ronnie, for those questions. Just with regard to EMIS, we will make sure that we've got a very senior clinical input in the task and finish group, Ronnie, with regard to that work alongside planning colleagues as well. So we're having discussions at the moment with Stephen Powell, Director of Planning and Performance, and also Kate Wright, our Medical Director, to get that attendance and that clinical voice absolutely front and centre to the development of the model. So some reassurance on that, and we will seek further reassurance through the Joint Commissioning Committee at every meeting on the progress that we're making with regard to that point. So thanks for raising, and then I'd ask Mez to respond around vaccine fatigue. Thanks.
Diolch, Hayley. Thank you, Ronnie. Mez Bowley, Director of Public Health. So, as you say, the COVID vaccination programme for the spring campaign launched early April, so we're about 5-6 weeks in. We have adapted the programme in light of reports of sort of vaccine fatigue, but I have to say, for residents of Powys, do respond, well. The cohorts in terms of being vaccinated in the spring programme is a smaller cohort than the autumn cohort, so we are taking clinics out into communities to try and increase and improve sort of access to residents. But in general, the uptake is good, but it is lower than what it was when the first COVID vaccine started to be rolled out across Wales.
Thank you.
Thank you. I can't see anyone else wanting to come in. Hayley, I just wondered if I might just say a couple of things. One is a really heartfelt well done to Cottage View on the very affirming and encouraging CIW report that was received. Really good to see, and congratulations to everyone for that. But also just picking up the section in your report on third sector review of SLAs, I just wondered, because some of the contracts and agreements and so on with third sector organisations go back a long time, don't they? And when we think about going forward on the basis of impact, I'm just interested as to how impact is being determined and what criteria are being used, especially where contracts perhaps don't have explicitly within them what kind of impact is expected.
Thank you, Carl. I think, yes, I'm happy to answer those questions now. With regard to the executive committee business, Steve, could you come in on the third sector point, if that's okay? Thank you.
Thank you. Morning, Chair, and morning all. Steve Powell, Director of Planning Performance at the Health Board. So we are currently undertaking a third sector review, as Hayley has outlined in the paper, and we'll be examining all factors in that review in terms of the standard of service being delivered. Is it the service that we require as a Health Board and for our residents? And also the mechanism by which we should be going about that trading relationship with the third sector. So a full contract review and all the necessary update to paperwork and process in terms of standard financial instructions and so on that we need to follow. If we do decide to change the suite of providers or the range of services that we contract and commission against, that'll be done in full cooperation with those service providers. At the moment, we're in sort of this phase 2 of our review, and we'll be bringing back a paper to exec committee to determine next steps once we've completed that phase 2. But we will be conducting it in a sort of full, proper way, and obviously realise the impact of any changes, if we do make them, on any third sector organisation that is currently receiving funds.
Thank you, Steve, and apologies, my mind was mixing up the Chief Executive's report and the Executive Committee report. So I made those comments and asked them in the wrong bit of the agenda. So apologies from me, but at least what it means is that I won't repeat them later on. So sorry about that, Hayley.
It's okay. It took me a while to work it out. I was feverishly looking at my report to think. But yes, no. And just with regard to Cottage View, Carl, thank you. I mean, absolutely delighted, and huge thanks also to colleagues in Cottage View for achieving that outcome, particularly with the change of model that we put in place in the location over the last year. Absolutely delighted, and I think a lot of learning for us going forward as a whole organisation about the work that was undertaken there. So thanks for highlighting.
Thank you. So if there are no other comments or contributions in response to the Chief Executive's report, we move now to the reports from our various committees. Item 1.7 ar yr agenda, troi yn sylw at waith arwyddocaol iawn ein pwyllgorau, ein is-pwyllgorau fel bwrdd. As I think it's always important to say that a lot of very, very detailed scrutiny work is carried out by our committees. They, in effect, do the heavy lifting on behalf of us as a board, and the chairs of those committees, if you like, are the custodians of the source of assurance that comes to us as a board from those committees. And so what we try not to do is to repeat the conversations, the discussions that have been had within the committees, but to look to the committee for that assurance, and then of course as a board deal with any escalated matters, and also ask any questions and so on that we think are important. So I'm going to turn firstly to Kirsty, the chair of our Patient Experience, Quality and Safety Committee. Thank you, Kirsty.
Thank you. Colleagues, the detailed report is included in the board papers. Just a few items to draw your attention to. Previously, the committee have highlighted to the board issues around infection prevention and control. The committee continues to receive regular reports of the implementation of the improvement plan, and good progress is being made in that regard, which the committee is very pleased to see. Previously, we've talked about concerns around capacity of using the new Civica system. I'm delighted to say that we're seeing increasing use of the Civica system with some very rich and powerful data coming into the health board, which will enable us to use that patient feedback to shape services going forward, but we continue to keep an eye on that. And obviously the committee's priority continues to be around mental health and the deep dive into the quality and safety issues arising out of mental health services. We're very grateful for the continuing updates that we've had in regards to that work, and to provide assurance to the rest of the board that we will be keeping a very close eye on those developments, and will report back accordingly. But there were no new issues to bring to the attention of the board. Thank you, Chair.
Thank you. I'll pause just in case anyone wants to come in to discuss any aspect of the PECS committee report. Yes, please do, Chris.
Thank you, Chair, and thank you, Kirsty, for the report. I don't sit on this committee, so it could have already been addressed, but just for clarification, just let me come to the section. It's regarding the mental health quality and safety review and the deep dive. Obviously, they're always helpful because you pull out things and episodes of learning, and that's what I'm really looking at. You mentioned on page 2 of that report, which is 19 of the pack that I'm looking at, an audit of clinical systems has been undertaken. I just wanted clarification of what clinical systems those are. You've highlighted that there are some gaps requiring further ongoing work and triangulation, and I just wondered, are there any evidence at the moment of any lessons learned that can be shared with other areas within the organisation, so that we can show that we can generally improve as a whole organisation, not just in this particular area?
Thank you very much, Chris. You'll be aware that mental health services is the first service that has been put into local escalation since we created and implemented our new escalation framework. And clearly, we're not just looking at the service here, but we'll be looking to see what lessons can be learned right across the organisation. But Claire will be able to give you details on the clinical systems that are being audited. Claire.
Yeah, thank you very much. Thank you, Chris. So the clinical systems audit was undertaken to be able to take a number of key standards, some key national standards linked to Royal College standards, and the clinical audit focused on a number of things. So it focused on policies, focused on clinical audit and how audit learning and improvements are shared and disseminated, as well as looking at discharge planning, admission planning, and our MDT approach as well within the service. So that was broadly just some of the things that were looked at. There were some gaps identified, and that clearly led us to take the decision that we needed to have some local escalation arrangements. Those arrangements are in place. We have a robust arrangement for monitoring the trajectory of improvements, and we've got some very smart objectives and improvements that the team are realising. I report through to the Executive Committee on a fortnightly basis as I chair that scrutiny meeting on a weekly basis. I'm very happy to pick anything else up with you in more detail outside of the meeting. Thank you.
Hayley would like to come in, and then please do respond, Chris, if you'd like to. But Hayley, please.
Yeah, it was just on that final point that Claire raised, which is about the regular reporting through to Executive Committee. At our last meeting, we were provided with a detailed report, update report on the progress that is being made, and I'm really grateful. I feel it's really important to say that this is a supportive move in terms of placing a service into local escalation, which is about recognising what more do we need to do as a whole organisation to support the service. And I just wanted to share that I'm really pleased with the feedback that I've received directly from the teams, that their response to this has been really open and helpful, and that ownership of those changes and improvements are still in the hands of the service leaders and the clinical director, the head of nursing, and the assistant director of mental health, as an example. And I think it's important because, you know, sometimes when people hear about escalation, that you know, is difficult for a service, but it is about that additional support that we can place around the service to make sure that we can get the issues that we've identified resolved. Thanks.
Chris, would you like to come back in, or are you sure?
Yes, thank you, Chair. I mean, I should have said at the beginning that I'm Chris Walsh, and I'm the independent member with local authority responsibility. But no, I've had the assurances that have come through. It's because I haven't been at some of the meetings recently, so I hadn't picked up on the update. So I thought it was an opportunity to ask now. So thank you for that. I'm assured with the responses I've had, and I will pick up with Claire outside of the meeting as well. Thank you.
Thank you, Chris. I can't see that anyone wants to come in at this point, so thank you, Kirsty, and thank you to members of the PECS committee. We go now back to Hayley, and now for the report of the Executive Committee. Thanks, Hayley.
Oh, thank you, Chair. So I'll take the majority of this report as read. As you can see, it's a very active committee, and the paper covers the 6 meetings up until the 17th of April. We've covered off the mental health services escalation, which I was going to highlight in the report, and we've already covered Cottage View, but just one area to highlight. In our March meeting, we did agree the submission towards the Refit Cymru and Salix Wales funding programme. Now, what this is a Welsh Government funded Spend to Save scheme, which is targeted on decarbonisation and energy savings. And I think that, you know, we've set a really clear commitment on this agenda as an organisation. We're working with Vital Energy, who underwrites the scheme, to hear back, hopefully imminently, from Welsh Government regarding the funding available for the developments that we set out in this bid, which includes things like solar PV panels, LED lighting, insulation and draft proofing. And, you know, we are really pleased with our application. This is a ring-fenced funding pot in Welsh Government to support decarbonisation and energy saving, and if we are successful with that funding, that will give us a 16% reduction in our carbon footprint, which will help us to deliver against not only the pathway milestones towards net zero by 2030, and I thought it's really important to highlight, partly because of the commitment we've made previously in the board on this agenda, but also this is an area our frontline staff are really passionate about. So I'm really hoping we'll hear very soon from Welsh Government about whether we've been successful in securing this funding. Other than that, I'm happy to take any questions.
Thank you, Hayley. And I think Ronnie would like to come in, so please do.
Thank you, Chair. Before going on, I should apologise for the fact that I omitted to introduce myself properly last time. Ronnie Alexander, independent member. Hayley, I wonder if you will just permit me to pick up, please, on the DNA training review, which I think is quite interesting. And I wondered about the quantum of what that problem looks like. And the reason that I mention that is against the background of PADRs and just ensuring that everyone possible is as it were, compliant with that process, because that is the first line of assurance within the organisation in terms of governance. So grateful for any comments that you might have on that, please.
Okay, well, in terms of the general position around PADRs, as part of that process, every individual, that reflection point on their progress against statutory and mandatory training is part of the compliance that we seek in that individual PADR position. And clearly this, alongside others, are covered in that mechanism. With regard to the issue around the did not attend training, we have had some learning generally through incidents and issues that we need to make sure that we're proactively making sure that the position is supported to make sure that we're making best use of our training. So Deb, would you like to come in on the point?
Yeah, sure. Thank you. I think it's probably important to note the national piece of work that is taking place on all of the training that sits within the statutory and mandatory framework. It has grown it's grown exponentially, and I think probably needs a bit of a cleanse. So our local work is starting to report back to assistant directors, deputy directors and exec directors of the numbers of staff who haven't DNA'd, but we need to make sure that we're prioritising the courses that really do need to be attended because they are mandated by particular roles. So that's work in progress, but it's a common problem across other health boards and trusts, hence the national piece of work. Within the PADR documentation, there is reference to the level of compliance. So as that's happening either at the 90-day catch-ups or at the annual catch-up, there is an opportunity for a manager to discuss that with a member of staff and set an expectation if indeed they're falling short of the target. I hope that's helpful.
Thank you, that is helpful.
I can't see. Oh yes, so Chris would also like to come in on this report. So please do, Chris.
Thank you, Chair, and thank you, Hayley, for the report. I just wanted to pick up on, I think it's point 8 of that report regarding health records, and there was a particular reference saying that we were waiting for clarification of from Welsh Government regarding how long retention of patient records should be kept for. I just wondered whether that had been received or not.
I will have to check on that. In our March meeting at that point it hadn't been received, but I can see Kate wants to come in. Thank you.
I'm muted. I'm so sorry. Morning, everybody. Kate Wright, Medical Director. So, Hayley, it's just occurring to me this might not be the right piece of information, but there was, I think this is referring to the fact that there was some clarification needed some time ago about exactly which patient cohorts we could look at records for. And my understanding that was received several months ago. And so I think it has been received, but Hayley, having said we were waiting for something in March, I'm just going to have to check offline that was indeed the information and confirm.
Yes, it was the patients with long-term health conditions. I think, Chris, we could pick it up as an action. Have we had that yet?
I'm sure we've had that clarification, but I will double check.
Okay, we'll send a note out as part of the action log. Thank you.
Thank you. Thank you. Thank you, Chair.
So no one else wants to comment on the exec committee report. So thank you, Hayley, and thank you to all of your exec colleagues for the huge amount of work that that gets carried, that is transacted and noted and appreciated. We now invite Robert, the chair of our Audit, Risk and Assurance Committee, to present the report of his committee. Thank you, Robert.
Thank you, Chair. The written report covers the meeting on the 11th of March, and I updated this board verbally on the 20th of March. So I wanted just to make 3 observations from the 14th of May meeting. The first is that we reviewed the draft Health Board Annual Accountability Report and accounts and took assurance that they'd been developed as per the guidance and submitted on time. The second is about internal audit. Over the last year, we've had over 20 internal audits done, and there have been only 2 limited assurance results. One of those was very predictable. It was about the the huge amount of money we would need to restore our aged estate to pristine condition. And the other one was about IT governance. A lot of work has been done on that. We are told that only having 2 limited assurances in that way puts us above average compared to the other health boards. So we are obviously quite pleased with that overall result. And then lastly, external audit plan, which is included in your pack. And I just wanted to draw attention to the All Wales thematic review on emergency care, which of course is very pertinent, bearing in mind all the concerns that we all have about that area of our services. Thank you, Chair.
Thank you, Robert. Would anyone like to respond to Robert or to any aspect of the committee report? No, so a big thank you to Robert and members of that committee. And so we turn now to Ronnie, who is chair of our Delivery and Performance Committee. Thank you, Ronnie.
Thank you, Chair. This is a brief summary report for the board because of the closeness of this committee to the board meeting today, but a full report will be provided for the July board. I'm going to extemporise around this a little in light of the fact that this report is so brief, and just say we had a busy committee agenda covering a wide variety of financial and performance matters. But I want to reference particularly that we took assurance from the finance performance report month 12 that the control total of 12 million had been met subject to audit, and that is covered elsewhere on the agenda this morning. We also considered the integrated performance report month 11, and that again is on the board agenda at a subsequent point. We considered the annual delivery plan quarter 4 for last year and took assurance that appropriate monitoring systems are in place. That again is on the board consent agenda this morning. And finally, we discussed at length the organisational escalation status and noted the intention to undertake a self-assessment against the NHS Wales framework. We particularly noted that confirmation of the de-escalation criteria from enhanced monitoring was awaited from Welsh Government. But in summary, Chair, there are no items to escalate to the board at this time. Thank you.
Thank you, Ronnie. Again, I'll just pause to give people an opportunity to respond or to comment if they would like to. I can't see that anyone does. So once again, thank you, Ronnie, and thank you very much to members of the Audit and Risk of the Delivery and Performance Committee. And so now to Ian Phillips, chair of our PPPH, the Planning, Performance and public health. I've got that wrong, haven't I, Ian?
Partnerships.
Partnerships, yeah,
Partnerships.
and
That's
public health. It's always what PPPH. Okay.
And just to clarify as well, Robert is the chair. I'm the vice chair. He was unable to make it. Again, our meeting was last week, so you've got a list of the number of important documents that were considered by the committee in the pack. I'd just like to highlight a couple of things if I can. We've got the annual report in which the committee took assurance that we are operating effectively, and that's later on in the agenda. I did want to say a little something about the really comprehensive strategic change report, which detailed all of the strategic programs of work that's going on across NHS Wales and across the board as well, which potentially have an impact on Powys residents. It's an extremely complex landscape with a huge number of interdependencies and overlaps. And it was really pleasing to see the level of detail in that report, and the committee again took assurance that the systems and processes are in place to ensure that the health board are being proactive in monitoring progress, activity, and actively influencing these programs where necessary. The final thing that I'd like to highlight is there were a number of overlapping issues, specifically the weight management pathway and the whole systems approach to prevention of obesity. And it was really great to see how much progress was being made on both of these overlapping agendas with what can I describe as a very modest investment. It was really good to see the amount of progress that's been made on the prevention agenda, which is such a difficult agenda to get into with all of the operating pressures. So a really good return on investment, I would suggest, and I think the committee took great assurance from that. At this point in time, there are no issues to escalate to the board either. Happy to take questions.
Thank you, Ian. Would anyone like to respond to Ian and this report? No, so thank you, Ian, and thank you for chairing the meeting, and thank you to members of your committee for the important work. And so just before we move on, just to skip back really just for awareness and attention to the beginning of this report and to the number of escalated matters that are logged there. There's nothing today for our attention particularly, but they're there to, if you like, keep the awareness of the board on those specific aspects of the business of the various committees. And so I just thought it was important to raise awareness and to draw attention to that important element within these papers. So we move to item 3.1, which turns our attention to the delivery plan for this year, 2024 to 25. And I think Hayley's going to contribute initially in terms of the context and so on, and then Steve will guide us through the actual paper and the plan. But first to you, Hayley.
Yeah, thank you. So yes, so this annual delivery plan reflects the plan that we submitted to Welsh Government in March. Obviously, it's important that we do have a plan. We're already working to it because we're midway through our Q1. But I wanted to make sure that board members were aware that we have now received from Welsh Government their feedback regarding our submitted plan. We received correspondence on the 3rd of May. As you're all aware, we knew we were submitting a plan with a £24.9 million deficit, which is clearly not meeting the target control total set that we did meet in the last financial year of 12 million. So the feedback from Welsh Government on our submitted plan is that they do, as Ian's mentioned, welcome the ambition set in our plan regarding the shift to prevention and a preventative approach, but the plan as it stands needs to be looked at again. It is not supportable or acceptable to Welsh Government, and we've been asked as a board to urgently reflect on the underlying risks and the choices that we need to take to deliver an acceptable plan that provides a level of improvement and a material improvement in the significant deficit position that we're currently holding. So we've been asked to do this alongside other health boards have been asked, provided feedback as well, and are also sort of in dialogue with Welsh Government regarding their plans. For us, we've been asked to resubmit our revised planning position to Welsh Government by the 31st of May and indicate clearly how we will make this improvement and also any changes or impact on ministerial priorities and outcomes. Now, clearly, the plan we approved in March was, at that time, our discussion was about the balancing of the factors of quality, access, safety, finance, and all the requirements set out for us. But for us now, we will need to, as a board, discuss and agree the substantial additional actions we will need to take in order to respond to the Welsh Government feedback. And as we work through this, you know, we clearly need to work extremely closely with our frontline staff, first of all, and also with our stakeholders and across the whole system, and importantly, the public. And I know that we've started conversations with Katie Blackburn, Regional Director of Llais, the National Citizens Voice body, and we will need to work very closely with Llais and other partners as we proceed to look at the revised submission. The other issue I think I should highlight is building on Ian's report earlier of the comprehensive report received at the last PPH committee regarding the strategic changes. Clearly, other health boards are looking at their plans currently as well. So as a commissioner, we will need to understand what does that now mean going forward in terms of any additional changes or requirements that we have as a commissioner as well. So I wanted to share that context because clearly, as we consider today's annual delivery plan, because it's important that we're working to the current plan until we change it, we need to expect that this plan will need to be amended to reflect our revised submission in Q2. And I also need to indicate very strongly to the board that part of that will probably require substantial discussion about prioritisation of the key outcomes and requirements that we need to deliver in year. So that was really my contextual introduction, Chair. And I think if you're happy, Steve, to just introduce the paper, recognising this is probably just for Q1 until we actually have got to a position where we've confirmed the final submission to Welsh Government on our plan. Thanks.
Yes, thank you, Hayley. So just to add, but not to try not to repeat some of what Hayley said, this is our baseline document that reconciles back to our submitted plan. We will be held accountable for this plan, as Hayley said, until it changes. We've built the plan as a subset of the strategic document that we sent in, and each executive lead has been part of that building of the delivery plan. Where some of the executive portfolios have changed recently, we've noted that in the delivery plan. The plan itself, it is pretty comprehensive in terms of its span and coverage to ensure that we capture the whole component of our plan. And in terms of the way it looks in each section, you will find who the lead exec is, the intended outcome and impact of the action, the deliverables, the timescales, and we've included a delivery confidence assessment in terms of how we feel that those key deliverables are going to be executed. So that's the format of the report, Chair. With obviously there's a lot of detail in it. and we will be then running through the quarterly review mechanism as we normally do to assess our own performance and risk, and then critically each of these update reports get formally reported into Welsh Government. So Hayley, did you want to just add anything to sort of wrap that up?
Yeah, thank you, Steve. I just, it was remiss of me, I'm obviously Kathy Poynton's on the board here for us, but that relationship I mentioned about our internal staff and how do we work together across the whole organisation with the challenges that we have, but particularly also I should have mentioned staff side and the importance of our working alongside our trade union partners as well. So other than that, no, happy to move on to questions. Thank you.
Well, I was just going to say, Hayley, that any changes we do make to our delivery plan on the back of any resubmission to Welsh Government, we will transact that through a sort of change variation to our plan, so there's complete transparency and audit trail around what we've done and why, and the revised impact on our delivery plan. Thank you.
Thank you both for that, you know, challenging context. But as you say, this is the plan that we're working to currently. I know that colleagues want to come in, and I'll turn to them. I wonder, Steve, might you just share a reflection with us? So when you look at the various, as you said, lots of detail in the plan. A number of the actions are described as having a low confidence in terms of their deliverability. I just wondered what, as a board, what we should understand by that, because you know you could look at it and think, okay, what that is telling us is that don't expect it to happen.
Yes, thank you, Carl. So we've introduced this for the first time at this point of the year, and I think in one or two items since we built the plan, and a number of items have changed in terms of deliverables, certainly on one or two of the digital schemes. So it is probably unusual to submit a plan with low confidence levels in it at this stage, but if that's a factual representation of where we're currently at, that's what we've chosen to do, and those will be key areas of focus now going forward to examine, can that performance be improved, or if the actions cannot be delivered in either the respective quarter or year, should that be amended and carried forward to a future period. But I mean, fortunately there are not too many of them, but there are some.
Thank you. Hayley, would you like to come in on this point before I go to others?
It is this point, if that's okay. So the number of low confidence is relatively low. I can't have the figure. I think someone said there may be 10-ish. I'm not sure. I'd need to check. I'd have to count them now. But what I was going to say is that we've brought in this discipline and this sort of visibility to the report. But this isn't unusual. This is the start of the year. This is Q1. And therefore, some of these things need time and consideration to actually build confidence. So from my point of view, looking at it, this is bringing the visibility of where we start the year, and as we proceed, I expect the confidence to increase as the further work and the scoping and what we're doing and how we're doing gets confirmed. So I just wanted to give some reassurance that it's more visible in the board report, which is a good thing, but it is not unusual to have at the start of the year lower confidence, and that being built when further work analysis or the milestones are being met. So I just wanted to share that, but clearly as we go through the year, if we're not making progress on that, that's something that committees and the board will need to discuss.
Very helpful. Thank you, Hayley and Steve. So Simon, please come in.
Thank you, Chair. Simon Wright, independent member. Hayley, I just want to go back to the context and to ask a question, because I recall that in our earlier submissions to Welsh Government, we did set out a number of areas where Welsh Government action or national action could help, particularly help on the budget and finance side. So my question is whether we've had any movement from Welsh Government on any of those aspects that we, and I suspect other health boards, have requested from them?
Thank you, Simon. That's a really important question, and I think that reflects the conversation we had back in August of last year when we were again asked to revise our plans to meet the target control total that we were given. And in that, as you rightly say, we clearly identified a number of areas for national that would benefit from either national policy, decision making, or direction or coordination. What the key change that's been put in place since last summer is the Value and Sustainability Board that is led by Judith Paget as the NHS Wales Chief Executive, but also as the Director General Health for Social Care and Early Years. And, you know, I attend that meeting. It's a very important mechanism. It is fundamentally about consolidating and driving forward some of those national areas that we need to actually look at a more consistent basis. So to give you a little bit of a insight into this, and we could perhaps bring this to a bit more detail to a future report, but there's a I lead a work stream on continuing healthcare, for example, alongside colleagues on behalf of Wales. There's another one on workforce and things like agency, international recruitment, nursing headroom, all those sorts of things are discussed in that space, but also other that's examples around nursing. There are others that have been picked up in the workforce element. There's one around non-pay and procurement and actions around that, and also clinical variation and service reconfiguration. The other national piece of work that's been set up under this programme is the Medicines Value Unit and the work around prescribing and the actions that we need to take around the 5 work streams around that. So things like contract coverage, home care medicines, what else is there? Medicine savings, primary care prescribing, all those sorts of things. So instead of one health board dealing with that, we're looking at it consistently across the whole of Wales. And also the other development is the vault that's been developed. There's a lot more analysis and information now and benchmarking being undertaken on a national basis to identify what it looks like across the whole of Wales. So I think that's been the major change and focus that we've had. But what I would say is that I think it would still be very important for us in our submission, in our revised planning submission, to revisit those areas again and see if there are additional actions or factors that we would like policy or national action to be coordinated upon, and to include that in our response that goes in at the end of this month as well, Simon. So it's an important area, and I think you know, I think it is important for us to highlight where we think, particularly for us with such a balance between our provider responsibilities but also our commissioning responsibilities, that we get a clear view about, is there anything else that we can identify that we would wish them to take action on.
Right. Thank you, Hayley.
Ian, please.
Yeah, just a couple of ones. If I can pick up a little bit more detail on your, Simon's question, on your response there. I think what I heard is that some coordination is now happening at a national level, but my recollection is, bearing in mind that at that time our projected plan was our best offer in order to get that balance right to meet targets and maintain quality and ensure safety. There were a number of policy decisions that we were asking from Welsh Government to consider, and at that time my understanding is that that wasn't going to happen. There weren't going to be any policy decisions. So rather than that, so I guess 2 things. One is there consideration of the policy decisions, or is that still off the agenda, things that could help us? Bearing in mind it was our best effort, so our next best effort is going to have to be considerably a tougher ask for us as Post Health Board. And the second point on that really is, we're having a conversation now about it across Wales, which strikes me as being already too late, bearing in mind that we need to make significant improvement in our projected overspend this year, and we're already into this year. So having some meetings about it, is good on the one hand, but doesn't fill me with confidence on the other. The second point for me really goes back to the PPPH conversations in terms of getting that balance right between prevention and firefighting. And it seems to me that we're definitely in the firefighting mode, which is not great from a long-term perspective. I understand our statutory responsibility to balance the books, but if we don't, you know, again, I've not been 52 years in the health service, but I have been 45 years in health service, and wherever this in terms of our ability as a service nationally to concentrate on the longer term agenda, we're still pretty hopeless at it. I guess that's just a statement rather than a question, and a statement of disappointment on my part, I guess. Thank you.
Thank you.
Okay. Shall I try and respond? Really important questions. On the first point then around the policy decision. So I would say that we've clearly indicated so far last year where we would like to look at, and I know that there has been further scoping and review of some of those options that have been undertaken within Welsh Government, and they continue to be under review, because although it's a tough ask for us here in the Health Board around the financial position, this is a shared public sector challenge for the whole of Wales, and it is a really, really difficult challenge for Welsh Government in the middle, at the centre, in terms of being able to balance their budget overall. And the decision last year regarding redirecting the 425 million across NHS Wales was really challenging, because that was about prioritising spend in one area over another in order to make that happen. So it is clear to me that through both the Welsh Government statements, there's a recognition about the scale of the financial challenge, and there's a recognition this is difficult, and there's an expectation that there are very, very difficult choices for us to take, both at a local but also at a national level. And I think as we continue in this work, we'll be able to track whether there is a need also for further shifting in policy decisions to support the NHS more generally. But what I would say is the first step was that redirection of resource last year. And I think that, you know, I'm really grateful for that, because it's bad now, but it would have been far worse without that action as well. So it's one to keep an eye on, and at this stage, any further changes to policy, we will keep you informed if anything further comes out. But I do know the civil servants and the team of Welsh Government are appraising all of the available options, and have done so since last summer. I think the other issue around the already too late, there's never a right time, but we are in May this year, not in August, so we're already a few months earlier. Is there any way in which we can front load it before the financial year? Well, you know, let's see how it improves over the next few years, but I do fear, I feel the same way sometimes. Oh gosh, you know, how do we get this done? And I remember last summer and the very serious conversations we had about the target control when we received that as an organisation. And your final point, this is what's keeping me up at night, and it worries me. I've spoken to Mez as our Director of Public Health and our whole executive team. You know, there is currently a tension between fighting the here and now and the pressures we've got today, and actually changing the shape for the future, and that prevention approach. I will say, Ian, that I don't agree with you. I don't think we are hopeless at it. I think we're excellent at doing prevention for the resource and the investment that we're able to put into it. And the problem is that in order to put further investment, which we should, we have to disinvest from elsewhere. So I think that's the challenge for us strategically as a whole system, which is how do we balance today's problems with really that long-term impact. But I do feel very proud of the work that we do around prevention and public health and all of that. But, you know, the scale of impact that we need to achieve through that work comes with it a substantial price tag, and therefore it is about the investment decisions that we make. So if I'm frank, one of the issues for us is about clearly, perhaps in our response, and we'll need to talk about this because we haven't had the session yet, clearly stating at a policy direction perspective, if we're serious about prevention, comes with it that protection of resource to make it happen, and we need to support to do that, because we've got here and now today issues which are equally identified as needing to be addressed by the whole system. So I agree with you, Ian, on that point. Okay, is that all right, Ian?
Thank you for that really comprehensive response, Hayley. I think the only thing that I'd want to add is my gratitude for the effort, because we're quite a small board, and this is a lot of effort. So I recognise the fact that our capacity and our physical resources are limited, and I'm grateful to colleagues for all the work that they're putting in for this, which is taking them away from doing some other stuff, obviously. So thank you very much.
Thank you. And we go now to Kirsty. Thank you.
Thank you, Carl. Hayley and Steve, clearly it's disappointing after the work that has gone in to have the plan returned to us as being unacceptable. And I just wondered whether I could just pursue where we go from here. So I absolutely get why we need to have a plan, but you know, the paper is quite clear in what it's saying is that this now will have to be revised, and it has to be revised before and resubmitted before the end of the month. So
you've gone on to mute, Kirsty.
Sorry. My first question would be, you know, will we be in a position to resubmit to Welsh Government by the timescales that they've indicated to us? And Hayley, you spoke at the beginning about the scale. What will we need to do to gain a plan that will be acceptable to the Welsh Government? So I'm trying to quantify the journey that we will have to go on from where we are now to a plan which would be deemed to be acceptable. And can I ask then what the main focus of that revised plan will be? Obviously there is a very clear focus on financial resource, but I've also got concerns on performance and actually access to services for patients. I have good confidence in our provider arm, what we were able to do for patients, but I have less confidence in regards to our ability to commission services from other providers. So I'm just wondering, what is the balance in the revised plan between just simply focusing on financial resource, or actually what will we be looking also at our commissioning arrangements and improving performance in that regard?
Thank you, Kirsty. Really good question. So in terms of will we resubmit in time by the end of May, we will have to, and we will have to stand up the appropriate governance to do that. But I think it's the start of the dialogue. I don't think it's the end. We submit and then, you know, that's the end. I think there will be potentially further dialogue post that initial submission required to Welsh Government. Clearly at the moment we're in that space of the annual plan. So what are we doing this year in order to meet the challenge that we've had initially, which is that, you know, our current expenditure plans this year is unaffordable, and therefore we need to look at it again. The scale of the challenge that we're facing, we are in enhanced monitoring as an organisation, and clearly there is de-escalation criteria as part of that, which clearly states about the need to deliver against our statutory requirements around the finance, which is to have a balanced position. And clearly we're not going to go from a 25 million deficit to a balanced position in a year, or certainly it will take us a few years. And that journey, the scale of that challenge and how long it will take will require actions for us as both the provider and as a commissioner. And I think the balance for me on this is that we have to revisit, and I did raise it yesterday as an example in the Joint Commissioning Committee, which is now the arrangement we have in place that replaced the Welsh Health Specialised Services Committee and the Emergency Ambulance Services Committee, that we need to look at it across the whole of our expenditure. And we spend a lot of our funding in commissioned services, and so it will be about a balance of seeking the sort of financial improvement and performance improvements, because they come together across every item of expenditure as both a provider and as a commissioner. But you know, frankly, we will take some time to get out and back into a balanced position, and I really wanted to say that that will require the short term is different to the longer term model, and that will require a proper and full engagement and consultation with our public and with the partners that we work with day to day. So that we can't predetermine today what that will look like, but we can set out very clearly in our response the process that will get us to that point. Is that okay, Kirsty? Is there anything else you'd like to follow up on?
No, that's fine. Thank you very much, Hayley.
Thanks.
Medical Director Kate Wright, would you like to come in, please?
Yeah, thank you. So yeah, excuse me, really important discussion, and as we discussed, really challenging. I think I've probably said this before in board, but I think it's just really important to note that through all the discussions, we are really making every attempt to think about clinical safety and safety of systems, not only on any final models that we may achieve. There are opportunities. We know that in some areas, then actually we have patients coming to harm from spending too long lying in our beds at the moment. That's not good for patients. So there are opportunities to improve care, and that's the approach we're saying. How can we do things better? How can we do things in 2024 style? So I think, and that is the approach that we're taking. That said, it is challenging given capacity and all of the competing priorities we've got. And I think just to assure that we're doing whatever we can to make sure that we have got clinical safety at the forefront, not only in where we get to, but in terms of the resources that we have to get us there as well. So it's a sort of a constant check-in, but there are opportunities here as well.
Thank you, Kate. So just before I go to the recommendation, just a couple of observations from me. I mean, absolutely helpfully, the conversation has focused our attention not just on the difficulty of the decisions that we need to make, but the basis on which we make them. And I'd just like to draw attention to the section in my report earlier, which was in 1.6 of the agenda, where I listed the principles that we've adopted as a board that guide our decisions, and those principles remain. We will keep them under review, but certainly they are the basis, as it were, or the stable from which we make our decisions. Importantly, and also picking up on comments earlier, just to give public assurance and reassurance that we are acting as a unitary board in relation to this. So the full board has met on a number of occasions to consider these important matters. We will continue to meet over the next few days, and so the resubmission by the end of this month will be a resubmission that will be fully informed and shaped by our discussions as a unitary board, and which in governance terms I think is important simply to clarify. But given those final observations, and again acknowledging the context that Hayley has outlined, that we are where we are, this is the plan, although we are going to have to revisit it and resubmit. However, given that context, we are asked today to receive and approve the annual plan, recognising it's fully aligned to the original submission in March 2024, and that this plan will form the basis of the quarterly review monitoring reporting cycle of progress against the plan, and will be reported to the board as it was in 23-24. So as I say, within that broader context, would you please indicate if you are not content to support that recommendation? In which case it's supported unanimously. We turn our attention now to item 3.2 on the agenda. Just as an introduction, as an organisation, we have an arm's length charity, the Powys Health Charity, and that charity has one corporate trustee, which is us, the Health Board, and therefore that's why, as it were, these accounts and the annual report appear on our agenda as a board. And so I'm going now to our new substantive Deputy Chief Executive, and I take the opportunity, Pete, to congratulate you very, very warmly on your new appointment, and absolutely delighted and look forward to continuing working with you in that role. But also our Director of Finance. So over to you, Pete, and I know that you'll introduce colleagues from Audit Wales to contribute to this item.
Thank you, Carl, and thank you for those kind words, much appreciated. So we have here the Charitable Fund's annual report and annual accounts. Included with the report and in the paperwork is our full set of accounts, our annual report, our letter of representation, and the ISA 260, which is the Audit Wales report on our accounts. As you've already mentioned, Carl, we have Mike Jones with us, and I'll bring Mike in a bit later to comment on the ISA 260. The first thing to flag is that there's been a delay in the submission of our annual report and our accounts in relation to our charitable funds. This is in relation to an issue that was with our fund holders, our fund managers, Brewin Dolphin, and it was something that impacted on a number of health boards. And again, Mike may want to comment on that, but that issue has now been resolved. We do have an unqualified opinion in relation to our accounts, and I think I won't go through the full detail, but just to flag that in the year 22-23, we received income of circa 226,000 and we spent circa 321,000. But just to flag that we do have funds held with our investment advisors of a circa 3.32 million in value. The full detail of the accounts is as included. This has been through our Charitable Funds Committee, and it is the Charitable Funds Committee that have recommended that this is approved by the board as trustees, as Carl has outlined. So the key points I wanted to make, and if it's okay, I'll ask Mike just to come in and comment on the ISA 260, if that's okay, Mike. Thank you.
Thanks, Pete. Thanks, Chair. Yeah, Mike Jones from Audit Wales. I'll take the ISA 260 report as read. And I guess the only bit I was going to draw to your attention was the delay in signing that Pete's already highlighted. So from our point of view, actually, we'd completed the audit and finance had submitted in time to meet the Charity Commission's deadline. We were waiting for external assurances from Brewin Dolphin. Their auditors give us assurances around internal controls, and there were some weaknesses which they've identified. But that report was not given to us till March and not given to the Health Board until March. So that was the delay. We then had to consider what those weaknesses meant. We've considered it and it's got no impact on our opinion, although clearly the Health Board may also need to consider those weaknesses identified. So probably as much as I want to say, but happy to take any questions along with Pete if the board stroke the trustees have got any.
Thank you both. Sorry, Pete, do you have anything else you'd like to contribute?
No, thank you, Carl. I was just going to thank Mike, actually. Thank you.
Okay. Just before I go to Mick, it's probably important for me to say as well that this report and these accounts have been scrutinised and looked at by our Powys Health Charity Committee that I chair. And so that detailed work has been done, and the recommendation from that committee is that the board approves them today. So, let me go to Mick. Thank you, Mick.
Prynhawn Dar, Mick Janassi, independent member. Thank you, Carl. So I think given the information provided, and particularly the unqualified opinion from the external auditors, I think we can take assurance from it that the fund is well managed, it complies with the relevant financial rules and regulations. But as I read the report, it just raised for me some broader questions about impact and whether the fund is, for want of a better term, whether it's working as hard as it can to deliver benefits for patients and staff. So if my interpretation is correct, in round figures, the value of the fund is just over £4 million, and so we spent 320,000, of which I think 124 was in support costs. So that's effectively £200,000 worth of benefits for patients, staff, equipment and facilities. So my first question really is that a reasonable rate of spend for the scale of the assets that we have? So on a fund of £4,200,000 is around 5%. So is that a reasonable kind of output? I don't know the answer. I just wondered how the committee makes that judgment. So how do we compare with similar funds in terms of benefits delivered versus capacity to deliver benefit? And I just wondered if there were kind of performance expectations or sector norms that we can use as a comparator. The second question was about the administrative costs of managing the fund. So is that proportionate to the benefits delivered? So again, very round figures, we spent £200,000 on patients and staff and benefits for an administrative cost of 120k, which is again, round figures about 40%. So my question is that a proportionate spend on administration for the benefits that's delivered? So in the round, I'm just interested in whether the money which has been donated is actually working as hard as it can.
Yeah, thank you, Mick. Before I go to Pete and perhaps others for the finance side, as it were, as chair of the committee, just an observation from me. I think you're absolutely right to highlight that. I think it's fair to say that since we have invested in the management of the charity, that actually the charity has gone from strength to strength in all manner of ways, through its engagement with the organisation, its raising awareness, communications, marketing, but also ensuring that the charity operates within the strategic framework and in alignment with the strategic direction of the organisation. Early days, because this way of working has only been put in place in recent years, but actually the charity is in a much stronger position now, in my view, strategically and in terms of the way in which it's managed and so on, than perhaps used to be the case. And the second observation is that we're continuing that journey. So the next step of that journey is to inaugurate, and we have our first meeting in July, of what we will probably call something like the Powys Charity Health Alliance. And that's trying to ensure that the work of the charity, yes, is driven by strategic direction, but also works very closely with Leagues of Friends and with other bodies who are important stakeholders and partners as we seek to, if not pool, but as we seek to coordinate our resource in the support of our health services in Powys. So I think you're absolutely right to draw attention to that significant investment in the charity management. But certainly from my perspective, things are strengthened. But I will go to Pete and whoever else wants to come in to respond to Mick. Thank you, Pete.
Yeah, thank you, Carl. I think you covered most of the issues. I think, Mick, I think they're excellent questions, the ones that as a board we all should reflect on. But as Carl has said, the investment in the charity team has been for a number of purposes. One, to promote the charity, to promote its use, to make sure that everyone knows about the access to it and the ability to put in bids to use those funds. And secondly, to do the work around generating more income for the charity. What I will say is, since the team have been in place, our spend has actually increased on some of the previous years. We've had a relatively low level of spend in this area for a number of years. And I'll just reference the fact that the board made the decision around the level of investment we made with our investment partners and set a target around the level of income we were looking to achieve against that as well. So I think the other point just to make is that we have to be very clear that any bids or any expenditure meet the purpose of the fund. There are strict rules around what's charitable funds, what's not, and we always make sure that we comply in terms of that governance and what's happening in that area. And we know that other bodies have had difficulties in the past in relation to that, so we'll be very careful. But Mick, you're absolutely right. I think there is more we can do. There's more we could do to use this money to benefit the patients and population. And as Carl said, we're trying to do that in that planned way and approach via the charitable funds team.
And Helen, would you like to come in, please?
Yeah, thanks very much, Carl. And Mick, thanks for your questions. They're really, really helpful. Just two things I wanted to add, really. And building on the fact that the existing team haven't been in place all that long, the strategic objectives for the charity were agreed just over a year ago. Probably about 15 months ago now, and in February, I think it was, of this year, we held a bit of a workshop which included members of the committee and some other colleagues as well, and we just did a bit of a check-in on those in terms of their continued relevance 12 months on, but also the appropriate alignment with the health board objectives as well. So there's a bit more work to do on that, as always, with things that are so new. But I think the work that's been done around brand marketing and now the development of the new website, some of that will help some of the kind of issues that are raising. But I think, you know, I think infancy in the right way is perhaps the right way to think about it, and we have more to do. Carl, if I may, just particularly, I was going to mention this at the end, but I just there's been lots of positive comments made about the charity. Just wanted to make a particular thanks really to Abe Sampson and Shania Jones, who are our two members of staff that kind of drive this forward, but also recognise the real team effort that we have here from colleagues in finance, comms, facilities, estates, and indeed the fund managers as well. That, you know, this is a real team effort across Team Powys, so to speak. So I think there's some real opportunities ahead for the charity in terms of how it uses its funds, but also increased opportunity with the public fundraising and strategic partnerships as well. So I think there's some exciting times ahead. Thank you.
Thank you. So before I ask Mick, does he want to come back? We'll go finally to Robert, and then we'll probably need to move on to our next agenda item. Thank you, Robert.
Yeah, I welcome those questions, Mick, and just to add to the conversations that are already taken place, the committee is very keen to keep an eye on the balance between the staff, the money that supports the staff, although ultimately, of course, that does support the patients, and also the more direct expenditure on patients. And we're also, you know, if one were to examine the minutes, you would see there's definitely a dialogue there about a determination to make sure that the charity funds are not used to substitute for lack of money, core money, by the health board itself. So there's a lot of dialogue there, a lot of discussion there. But as others have just said, the expenditure on the support side of things is very much with the aim of expanding business and getting more income in the future. Thank you, Chair.
Thank you. Mick, would you like to come back on any of that or contribute?
No, thanks, Carl. I'm reassured by what I've heard, so thank you.
Well, thank you. So we come to the recommendation, which is to approve the fund annual report and accounts for the period to the end of March 23. And as I mentioned earlier, this recommendation, if you like, is recommended to us by our Health Charity Committee. So once again, if anyone isn't happy to support that recommendation, would you please indicate? So that's supported. And we turn now to the Director of Corporate Governance report, and to you, Helen. Thank you.
Thank you very much, Carl. So happy to present this report to you today. It's really trying to bring together a few governance areas that require the board's ratification or approval. I'll just very briefly take you through those to make sure that we've got them appropriately covered and understood. So the first one is to ratify the Chair's action that was taken on the 28th of March. Colleagues may recall that under ministerial direction, we were issued with all of the new governance or a number of the new governance documents for the Joint Commissioning Committee that Hayley referred to earlier on. We weren't able to turn those around in our board meeting due to timing. We agreed to do that by Chair's action. That was subsequently taken, and that asking the board just to ratify that today, and I can confirm that it was all undertaken in the right conditions. The second one is that we're required to report the application of the common seal to the board. That's happened on one occasion since the last report, and that was in relation to some leasing arrangements for the medical centre. That's listed in the report as well. Then the following two areas, the last two areas, are to approve. We've made some revisions, or we're recommending some revisions to the standing orders. The changes have been considered by the Audit and Risk Committee. They're detailed out in the table that's in the report. I've given you a link to the full standing orders. Standing orders is a very long document, so I've tried to draw out the changes. There is nothing that I would call substantial, colleagues, within there. It is really about making sure that they are fit for purpose at this point in time. We know Welsh Government colleagues are working on a review of the model standing orders that will take place during this year. There is also some work being undertaken on the model standing financial instructions as well. So this is about good housekeeping and appropriateness to our health board, and those changes are recommended. Just to particularly draw out, and in Hayley's report earlier on, she mentioned the changes that have happened with the executive team as were agreed at the Remuneration Terms of Service Committee. So we've updated the scheme of delegation, and that's provided within the papers for your clarity. So looking for approval of that if colleagues are content. And then the final one, as a matter of good practice, but also in compliance with the standing orders, we have reviewed a number of the committee terms of reference, and again each committee has played a key role in reviewing their own terms of reference. This is the culmination of that. Again, there is a link in the report to the full detail of the full terms of reference, and we've provided a summary on the last page of the report there for the key changes to each committee. There are a couple of what I'd call fairly minor movements that we're recommending just to help balance out and make things administratively more free-flowing. There are then a series of updates to all terms of reference that we will make, again just in line with good governance. We now hold our meetings largely by Microsoft Teams, for example, and there's some wording to particularly around frequency and job titles and so on. So we'll tidy those up across the piece. Remuneration in terms of service, and then the local partnership forum as an advisory forum will come forward to the next board meeting for your consideration. So I hope that's clear and makes sense, but very happy to take any questions. Thank you.
Thank you, Helen. A couple of things that occurred to me, if I may. Just a reflection on page 5 of the report and the stakeholder reference group in terms of the standing orders. So at the moment it simply says whether we decided not to operate an SRG, which is technically correct, of course. I just wondered whether it's just worth offering a bit of context to that, and perhaps I don't know whether anything needs to be changed at all. I mean, the reason is not simply because we are being defiant. It's because we look at what the breadth of our operation, and that we conclude that we actually fulfil the purpose of the SRG in various different ways, albeit that we don't have an entity that is called an SRG. And so just an observation. And then the second and final thing from me, under advisory forums, I just wondered whether you want to give an update as to where the thinking is currently in relation to the professional forum that we still don't have.
Yeah, thank you, Carl. Really good points. And apologies, I should have given a bit more context on the SRG. Of course, we covered that some time ago, so it has been some time. So yes, you're absolutely right. And we won't remove it entirely from the standing orders. We will clarify our position and clarify why we're not running it. So thank you very much for that point. In terms of the Healthcare Professionals Forum, so that's absolutely within our plans for this year. We had some capacity issues last year, in absolute truth, that was reported in the operational plan. It is in our plans for this year. We will be looking to work with relevant colleagues to get it up and running, and I think that's a really important voice that will then be heard and received around the board table. So in the context of this financial year, the board will see it fully operating.
Thank you. I'll just pause slightly just in case anyone does want to come in response to Helen and the report. But if not, we go to the recommendation, and that's that we ratify the Chair's action, we ratify the application of the Common Seal, we are assured that that action was taken in accordance with the standing orders, and that we approve the changes to the standing orders as set out in the report, including the revised board scheme of delegation in relation to the executive team, and we approve the changes to the Health Board Committee terms of reference. And so once again, please indicate if you don't support that composite recommendation. So that is supported unanimously. Thank you. We go to item 3.4 and the minutes of previous meetings. We have two sets of minutes for consideration. I'll take them separately, initially for accuracy. And firstly, the 20th of March, 2024. Please do, if you would like to suggest any amendments, corrections, changes, then please come in. And if not, we go to the minutes of the 11th of April, 2024. No one has indicated that they would like to mention anything in relation to accuracy, so we accept both of those sets of minutes as correct records. We're going to stay with you, Helen, and we're going to consider the proposed board assurance framework, which of course is something that is highlighted in our structured assessment. So anyway, I'll hand over to you. Thank you.
Lovely, thanks ever so much, Carl. And I'm really pleased to present this to you today. I think it's a reflection of the continued work for the board governance framework and indeed for the whole organisation, and of course continues to reflect all of your work in terms of the commitment to good governance that we have as a board. We haven't had a BAF in place for some time. It has been a gap in our framework. The pandemic got a little bit in the way, and then there's been various other issues in the meantime, but I'm very pleased to present this today. Having said that it's been a gap, we have of course always had in place a number of the component parts that have continued to operate. That's included our risk management framework, the quality and performance framework, of course, and our overall system of governance that we deploy in the running of our board and the organisation. So the framework in front of you today really sets out the purpose and the approach that we're proposing to take to our board assurance framework, and it will continue to, and it will, feature as part of board meetings into the future. Really focuses on three areas of overall assurance to the board. The first one being assurance against the delivery of our strategic objectives and what the quality of assurance is in place to underpin those, and indeed the risks that are there. So our corporate risk register will continue to play a key part in that. The second part will be the assurances against our governance framework, both in terms of compliance and deliverability and good practice. And then the third area that we will develop over time will be the ability for the board to request thematic reviews in terms of assurance mapping that could be in a number of different areas, but again will support and underpin the board's work. So initially, Carl, clearly the important thing is that we now mobilise and operationalise this. The initial focus for this current financial year 24-25 will be linked to our continued work on the corporate risk register and the assurance against our strategic objective delivery. And the second area that I mentioned will be around the assurance in terms of our governance framework and both compliance and deliverability with that. And I think both of those areas will be key. We will continue to mature those over the course of this year and into next, and then we'll pick up some thematic reviews at the appropriate time. So I hope that provides a bit of an introduction. Very happy to take any questions that anybody has, but it's presented here for your approval today, for which we will then move into the deliverability phase of the framework. Thank you.
Thank you. And really good to see this. It's something that has been in development and so on for quite a while. So really welcome. I'm going to go to Jen, but I just wondered, Robert, as chair of the Audit and Risk Committee, please, if there isn't anything, but clearly the operationalisation of this will be something that your committee has a particular responsibility around, and you may just want to offer an observation. But let's go first to Jen.
Diolch yn fawr, Helen. Jennifer Owen Adams, independent member. Helen, just want to firstly welcome this paper and all the work that's gone into it, and to observe the increased robustness of the governance. As we keep on maturing as a board, then we continue to mature in how robust we are in terms of our governance framework. As you know, I love all that stuff, and really supportive. So look forward to deploying and using these tools. I wonder, it's something I have talked to you about before. I wonder also, it's great to have that framework, but I also wonder what opportunities there are for us as board members to be trained in how to use them really well, and how can we execute great scrutiny? How can we up our game as individual board members in that space, given the improved toolkit that we are now going to be using? So would welcome your thoughts on what opportunities there would be to do that. Thank you.
So let's go to Robert, and then we'll come back to you, Helen. Thank you, Robert.
Okay. Thank you, Chair. Well, as you know, the Audit Committee has previously looked at the principles of the framework. We look forward to the next phase, and as always, Helen is ahead of the game, and she knows that there is a danger with these frameworks, that they can become unmanageable and therefore less useful. This is the experience of other audit members on other boards that they've conveyed to me, but she's aware of that, and so it'll be up to all of us, particularly during the first year or so, to make sure that we have something there which is very practical and we can use, and is not too unwieldy. Thank you.
Thank you. Helen.
Yeah, thanks, Robert. I agree wholeheartedly with that. Yeah, this has got to be something that's really helpful and useful and can draw the board's almost immediate attention to the key areas that need to be looked at, and that will be really important. So and Jen, that kind of links partly to your question, and thank you very much for that. So that we will absolutely be developing some of this together as a board. And then it will absolutely come forward for scrutiny assurance at the right point. But I think the presentation maybe isn't the right word, but for the want of a better one, the presentation of it and the way in which that's received and digested and understood will be really important that we do co-produce that. We've of course got our board development programme that will continue to run alongside that, and as you know, we've done a number of different sessions in there, some of which link to risk appetite and assurance. We'll continue to do that work. We've also got our board effectiveness work that's just coming to a conclusion reviewing last year, and we'll be presenting that to the board at the June board development session, and that will be a really great opportunity as well, I think, to look for any common areas of training, support or work that we may do linked to the BAF or other areas. So I think we've got a number of tools in place that we can continue to use and build into that board development and other opportunities. Thanks.
Thank you, that's very exciting. Thank you.
Thanks, and also just for me, I think that's really important, because I think Jen's if you like, making this practical question is really, you know, what does it mean to me? What does it mean to my committee or whatever is really important, isn't it? And so I really welcome, Helen, your suggestion of using those board development opportunities to tease out that question so that it means something real to all of us. And as Jen says, helps us to do our jobs better. Thank you. And so we come to the recommendation, which is that we receive and approve our new board assurance framework. Please indicate if you don't support that recommendation. So that is supported, once again, unanimously. So diolch yn galon I chi am bob peth hyd at hyn. We're now going to take a break, but just before we go to the break, we will be considering at item 5 the items under the consent agenda. We have invited board members to indicate if they wanted, if you like, to take something out of the consent agenda so that it is considered distinctively by the board. No member has indicated that they want to do that, but just before we come to that, I wanted to give people a final opportunity. So if there is anyone that wants to suggest that any of those consent agenda items should receive, as I say, distinctive and direct consideration, please indicate. No one's indicated, so in which case, when we do come to item 5, we will take those items en bloc. Let's take half an hour for lunch and reconvene at 1 o'clock. So thank you very much, bon appetit, and see you in half an hour. Thank you. Croeso nôl, a diolch i chi gyd am ddychwelyd mor brydlon. Good to be back with you. Well, very warm welcome back. Refreshed and replenished, I hope. So we go to our agenda once again, and to the items on our agenda for assurance. Initially item 4.1, and a couple of these items have already received attention at our committees, but not all of them. And so, for example, I understand that the financial performance report, month 12, was looked at by our Delivery and Performance Committee, but not month 1 because it wasn't available when that committee met. However, if the chairs of those respective committees would like to offer an observation or offer reassurance from on behalf of your committee, then that would be helpful, and please do that. So we go to Pete for the financial performance reports. Thank you, Pete.
Yeah, thank you, Carl. Good afternoon, everyone. So just take you through the finance reports. As Carl has said, we've got month 12, the final report for last year, and then month 1 of this current financial year. We've clearly referenced the financial position a number of times throughout the board meeting already. But what I'll do is I'll take you through the key points of the finance report, and then we can open up for some discussion. So first of all, taking month 12. So as already been alluded to, we've delivered, subject to audit, a position within our target control total, which was a maximum overspend stroke deficit position of 12 million. The final position is an overspend 11.9 million, which is within that control total, again, subject to audit. In relation to our capital expenditure, we remained within our capital resource limit. We had a total spend to date of 6.456 million, and that against our capital resource limit of 6.48 million. So worth just pausing on that and make a couple of comments that it took a significant effort by the Health Board, a collective effort of all budget holders, to maintain our spend, to deliver improvement in the areas we identified, to remain within that target control total. And similarly, in terms of capital, we received a significant increase in our capital allocation, towards the towards the end of the year, and we managed to discharge that spend, achieve the assets and improvements, and remain within our capital resource limit. I think the things I just want to flag from that in terms of the revenue position, the report was in the standard format. Our key cost drivers are those that we've talked about month on month. They include agency, our spend in relation to CAT and complex care, our spend in relation to pharmacy, and our spend in relation to our commission services. We know that they're our key cost drivers. We know that they contribute to our ongoing underlying deficit, and we know that they're areas of focus for us going forward where we can look to make improvement. The other area just to flag is that in terms of our savings delivery, in the last financial year, we did deliver just over £12 million worth of savings, and that included our original savings target of 7.5 million, and then the circa 3.2 million improvement as part of our target control total to meet the 12 million deficit. The key point to note, though, is in relation to that savings delivery, 5.7 million was recurrent, the remaining of which was non-recurrent. That again helps the committee and the board to understand how that contributes to our underlying deficit and the significant deficit plan we have going into this financial year. What I will say as well, I think we've had a lot of discussion around where we focus our attention. I think it's worth reminding the board and ourselves that we spend circa £430 million a year, and our duty in all cases is to make sure that we allocate that spend and that resource to the best possible place to deliver the best outcomes for the population of Powys. And that allocation of resource also includes our physical resource, our staff, our buildings, our equipment, making sure they're all aligned to deliver those best outcomes. So given that clear focus, we can focus on the opportunities that we have. If I just take us forward into the month 1 position, this month 1 position is reported against our deficit plan as submitted, but as we've already commented, that's not been accepted and not supportable, so further work to do. But against that deficit plan for month 1, we're broadly online. against that 24.9 million deficit. Slight variance of 300,000 in month 1 against an expected position of just over 2 million overspend. And that is in the main in relation to an increase in CHC cases towards the end of last year, which have an impact into this year. So I think they're the key points just to flag, Carl. As I said, we've talked about the financial position, other parts of the agenda. I'm probably good to pause then so I can grab a drink as my voice is going, and we can take any comments or questions. Thank you.
Thanks, Pete. I'll bring in Ronnie first, if you would, Ronnie. Either any questions you have individually or perhaps a perspective as well from the Delivery and Performance Committee.
Thank you, Carl. From my perspective, I'd just like to reflect back to month 12, and Peter's already referenced the financial savings that were made, the £12 million and so on. And I think it's really important that we acknowledge the considerable efforts that staff have made in order to achieve that. And you know, we do have, as we're all aware, substantial financial problems coming down the track, but I think it's important to reflect on success where that is warranted. Thank you.
Thank you. It's really good to invite Steve Elliott to come in, our new independent member colleague for finance. Thank you, Steve.
Thank you, Carl. Steve Elliott, Independent Member for Finance, as you've just said. And can I just say at the outset, thank you very much for the very warm welcome you gave me at the beginning of the meeting. And I'm very pleased to be part of the board, so thanks for that. Firstly, I was just going to reiterate what Ronnie has just said, commending the organisation, difficult situation as it was to actually delivering the savings to achieve the control total. I think it's also, for last year, I think it's also worth referencing the significant work that was done in terms of achieving the capital resource limit and what has been invested during last year. So that's the good news. Obviously, significant concern about the financial position in this new financial year. We've already touched on the fact that the current plan is not acceptable to Welsh Government, and what's obviously a concern, although you have just referenced the reasons for it, Pete, is the variance already against that plan, which, although small in month 1, could develop if we're not careful. So I was just really asking whether executives have a very robust process of scrutinising variances against the plan where budgets are at overspending, and making sure that there's sufficient challenge there, and the relevant budget holders are held to account for overspending. Thanks.
Yeah, thanks, Steve. Thanks for the comments on the positive side, and then really good point about the financial performance and how we monitor that and how we ensure that appropriate focus and attention is given in that regard. So in terms of the approach, it's a cascade approach. So starting at director level, each director's got a portfolio, and then throughout that portfolio there's a cascade of responsibility in terms of budget management, and then that management and the line management arrangements in terms of their financial performance. Also, in this financial year, there's going to be a regular monthly meeting with Hayley and myself, with each individual exec director, to focus on that financial performance, focus on our delivery against opposition, against our savings target, and any further actions to deliver against that run rate. And what I will just add is that in terms of general financial control and grip, it's been an area of focus for the board. It's been a focus in terms of internal audit to make sure we've got robust arrangements in place, and it's something that's included in our de-escalation criteria. So another chance for us to do a checklist against that to make sure that we're taking all of those actions and we've got as robust arrangements in place as possible.
Thank you.
Steve Elliott, yeah, so you okay with that, Steve, in terms of assurance?
Yes, thanks very much. Thank you.
Thank you. We go to Ian. Thank you, Ian.
Thanks very much. I just wanted to pick up the piece on where we focus our attention, bearing in mind the the scale of the challenge ahead of us. Appreciate that we need to look at everything. Something I've said before, when we've got a track record of strong financial performance up until very recently. Was it six years that we managed to balance our books on the trot? And I guess my view is that we didn't become financially incompetent overnight, which colleagues will have heard me said before, and therefore it just strikes me that it might be helpful for us. I would certainly find it helpful to be able to see what are the differences in are we going to go on to talk about performance, the next agenda item, things that have been outside of our control in terms of where the impact of inflation, wage rises, what's been funded, what hasn't been funded, in order to know the areas of performance that we need to really focus on. I'm finding it difficult to kind of separate out the fact that what we're looking at now is where we stand against a plan, but has for me lacked some of that context of where we've come from, for me to be able to separate out what was in our control and where we've been, for want of a better description, a victim of circumstances and inflation, if that makes sense, Pete.
Thank you, Ian. Pete, I wonder if we might take Kirsty's comment as well and then come back to you, and then we probably need to move on to the performance report. So thank you, Kirsty.
Thank you. First of all, like other speakers, just to congratulate the team on achieving what they did last year. There were times last year I did not think that was possible. And so to do that, I think, demonstrates a huge amount of hard work and commitment. But Pete, we are back talking about continuing healthcare, which is one of the things that continues to really, put pressure on our budget. And already in month 1, that's where the pressure is arising from yet again. We have talked previously about work to do to try and reduce cost around continuing healthcare. My concern is the nature of our population, which is going to drive some of that, as well as factors within the market, or perhaps a lack of a market, that is driving some of that. And I just wonder if you could give us an update on the work that is being done, both in the short term but also medium to longer term, to try and get a grip of finances around continuing healthcare costs.
Okay, so thank you, Kirsty. Thank you, Ian. I'll try and answer both questions in one, and then others may want to comment. So I think the key issue is, the pressure we face against our financial plan is a byproduct of demand, a byproduct of our aging population, and a byproduct of lots of those sort of operational challenges. So the financial challenge is a byproduct of the operational side of things we're trying to deliver. So we just run through those quickly, the key areas, and I'll include CHC, Kirsty, on that. So if you take our agency spend, we know that we have a level of resources needed to support the capacity we're providing for the services we provide. We know that we have a significant level of vacancies. We have a strong workforce programme trying to reduce those vacancies and retain people, but we still have the need for agency. That has a premium cost. That premium cost becomes a pressure. We need to use that substantive resource in the best possible way to provide the capacity and services without that additional cost. If I take our commissioning position, we've got an ageing population. We know that we've got the highest percentage of people above the age of 65 in Powys. We know that from our activity that we're purchasing from other providers, that the level of activity isn't growing significantly. That's notwithstanding the pressure in terms of those emergency admissions, but the age of people that are being admitted and the acuity of care that they're requiring means that is costing us more. So that again is a bit of a product of our population, our demographics, and it's the demand that's needed. If you look at CHC, again, there's a factor in there, Kirsty, you're right to point that out. What I will say is that there's an internal programme work looking to make sure that all of our packages are appropriate, that they're provided in the most effective way, and the level of care they receive is at the right level. And we also link into that national programme that Hayley mentioned earlier in terms of the Value and Sustainability Board, where there's been work to look at our high cost packages. And then beyond that, we are considering what else could we do? How else could we provide that care? And is there a more cost effective care that still delivers the level of care, the quality of care that's needed? I think they're probably the key things. It's really just making that point that our population demand, our capacity, and there's other factors I mentioned are the driver behind the financial challenge we face. So we know the areas to focus on. Is how we make sure we organise ourselves in that way to deliver the best value. I know it comes back to that's an easy statement. It's a huge challenge, but that's how we're focusing on things, and that's how we're trying to approach it. And I know that time is pressing, Carl, but I don't know if any other colleagues want to comment, because clearly that's the finance director and an exec director view that I've just given there.
No, that's fine. So yeah, so as I say, we'll try and keep contributions succinct so that we can have time to do justice to other items. But I know that David would like to comment, and so would Hayley. So please, David.
Thank you, Chair. And just to reflect the comments from Pete, obviously we are looking at what we can learn from the Value and Sustainability Board, with some work focused on our high cost packages of care. We are mindful that market provision in Powys isn't what we need it to be, and how we develop that is going to be our challenge. So we're working closely with the local authority to look at how we maximise the relationships and the willingness of our local providers to take those packages of care, and in fact going through a process at the moment to align our costings to the fair cost of care work that the local authority have been doing, so that what we really do is align the market in a way that doesn't create additional cost for the health board, and also aligns our contracting processes with theirs. As Kirsty has referenced, obviously there is a significant concern around our aging workforce, our aging population rather, and the reliance of the population on those types of services. And the trick for us will be to look at how we avoid people needing some of those services for as long as possible. And we know there are other very wicked issues, things like our length of stay in our community hospitals, which, when we see deterioration of our patients, could risk the fact that people need higher levels of care. So we're doing what we can internally to maximise the capability and capacity of our patients in a way that reduces their long-term reliance on that care. But this does remain a risk for us, and one that we are as a health system focusing on, and there will be a fairly comprehensive programme of work this year to focus in on this very area.
Thank you. And Hayley?
Yeah, I mean, the demographics we face is particularly challenging for us in Powys, but just in relation to context, around 5%, around about circa 600 million of the NHS Wales budget is spent in this area. So I'm sharing that because it's an issue that it affects us all. And the All Wales work that I've been involved with, it's really interesting. We started off looking at high cost placements in the space, in the area of mental health and learning disabilities. And, you know, again, that review, that work included reviewing across the whole of Wales over 500 cases. And that work identified around a third had a potential cost reduction opportunity. And there were several themes around that, themes like care not being delivered as commissioned, the patient's current needs having changed and therefore not meeting the current care inputs that are in place, and the really fundamental one, same health board providers contracting for the same care but for different costs. And so one of the key issues that's come out of this work is that a cost sort of pricing, consistent pricing group has been established now on an all Wales basis to start to share this intelligence and to understand what this looks like and what are the opportunities if we work much more in a coordinated way across the whole NHS, particularly with regard to consistent pricing. And then another area in particular is not to forget is the importance of health and social care cooperation in this space. And clearly we've made some really good progress around that relationship and how we work together on the front line in that MDT space, in this space, between the local authority and the health board. But again, there will be further national work undertaken to look at bringing health and social care representatives together to discuss and see if there are other solutions to these challenges for agreement by all. And I think I'm sharing that broader context because I think with our particular ageing demographic, if we can contain the costs, you know, we will have increasing needs coming through the system. And if people are eligible, we need to meet their needs. It's about how do we meet those needs in the best value way that delivers the right quality and care for these individuals, but also at the best possible price.
Thank you, Hayley. So I'm just going to pause briefly in case either Ian or Kirsty or indeed both of you would like to come back on any of those responses.
If I may, Carl,
please.
It's very good to hear David talk about a comprehensive programme of work locally, and obviously that has to take place in the context of the national work. But if we're doing that work, it would be useful to know, I guess Hayley's kind of hinting at it, what does success look like for us in that programme of work? So if maintaining our figures is what success looks like, that's great. But if it's not, I'd like to know how we're going to monitor that work and crucially the impact of that work and when we would be looking to see some, you know, some developments really. So if that work's going on, how do we capture that and what does success look like?
Hayley?
I'm happy to provide that additional information to the relevant committee. I mean, I think it is tricky because obviously clearly there is opportunity for some cost improvement, but we did have a review locally as part of this national work stream, which didn't identify the same level of opportunity for us in Powys as we would have liked. I know that sounds awful because that sounds as if I'm saying there is nothing to go at. I think there are things to go at, but I think that it was gave me quite a bit of assurance to hear that when the national team looked at particularly our high cost mental health and learning disability placements, there were some actions identified, but in terms of substantial savings, that wasn't in that space. But I agree that trajectory, Kirsty, is important to share so that you can have further assurance.
Thank you. Ian, do you have any other contribution?
Nothing further for me at this stage. Okay. Thank you.
Thank you very much. Just for clarity, Hayley, you mentioned providing information to the relevant committee. I assume that would be D&P. Is that right? So in terms of clarity for the action, as it were, but thank you. So the recommendation is that we discuss, and I think we have, and note the reports. If anyone wants to indicate that they don't think we've done that, please do. So that recommendation is supported. We move to the integrated performance report and to Steve Powell. Thank you, Steve.
Thank you, Chair. Afternoon, everyone. So this is the performance report to month 12 that wraps up the 23-24 financial year, and elements of this report you will find in our annual report once published. If I start with provider services, I mean the position on planned care significantly improved in March, and that was an improvement against a forecast position that we'd taken to D&P in the month of February. Diagnostics and therapies also followed that same pattern of improvement, at the year end, and that's against the backdrop of, obviously, as Pete said earlier, delivering on the money as well as the performance. So, you know, particular congratulations to the provider arm staff for managing those two key outputs of the health board. There were a number of trajectories, however, that we'd set ourselves for the 23-24 financial year that we did miss. We have got recovery plans and performance trajectories into 24-25. From a mental health perspective, there are a mixed position in terms of performance in our provider arm. Our under 18 assessment, intervention and care treatment plans, those were all achieved in the month, but neurodevelopment performance came in at a performance target of 42% against a target delivery time of 80%. So that's an ongoing cause for concern. And adult mental health performance, that also improved in month, particularly the notable return of compliance with the Part 1B therapeutic interventions that is now back compliant from a previously very low position in February. From a commission perspective, the themes are continue to those that I've reported previously. From a planned care perspective, overall waiting list sizes are either increasing or stable. The number of extreme long waiting patients, so that's patients waiting 3, 4, even 5 years for care, is coming down across Wales and England, but we still experience that variable wait times in the differences of queue and backlog recovery between English providers and Welsh providers. Cancer care is also poor in terms of delivering against the 62-day targets. A lot of additional scrutiny is coming in on those providers that deliver cancer care in both systems that we commission with. And ambulance performance for parish residents also remains poor, with 45% of the calls in the month that we're reporting meeting the 8-minute target. So obviously this is a position to month 12. Our focus has now turned to performance improvement and delivery in 24-25, and a number of key documents have been received, which we'll need to be cognizant of when we resubmit our plan at the 31st of May. So we've had 4 letters of correspondence in. One of those is clearly on the finance and the unsupportable plan, but 3 out of the remaining 3 letters are all about performance improvement across planned care, mental health, and an additional assurance piece required on the delivery of planned care and efficient pathways. So there's also an improvement plan being developed locally with members of the Joint Commissioning Committee, because I would like to see a performance improvement plan for ambulance services in Paris, and I met with a number of members from the Joint Commissioning Committee yesterday to start developing that plan, which we'll then bring through our delivery and performance committee. So I'll pause there, Chair, for overall comments and questions from wider board members, and I may well need to bring in executive colleagues to answer particular portfolio questions. Thank you.
Yeah, thanks, Stephen. As you indicated at the end of your comments there, in a sense, this is a retrospective report and yes, forms, if you like, the baseline from which we go into, and indeed started going into this year. So, yes, you know, just so in a sense, you know, there's water under the bridge, but equally there's water still to come. Absolutely. So, and just as I'm pausing to see if anybody does want to come in, colleagues may know that the Cabinet Secretary for Health and Social Care has very recently, as part of the new accountability arrangements, put in place a monthly Chairs Assurance Group, and that met for the first time this morning. And exactly as you say, Steve, there is particular focus on cancer care, planned care, and so on. So, so that the scrutiny from a national level is becoming more focused, yes, and so thank you. So Does anyone want to come in at this point? I will pause. Ronnie, as chair of DMP, do you have a do you have a contribution? Please don't think you have to, but I'm just giving the opportunity.
No, thank you, Chair. In the interests of time, I will not say anything further. I think Steve has covered the situation very comprehensively. Thank you.
Okay, well, once again, where the recommendation is that we discuss and note the content of the performance reports, and that we assure ourselves, importantly, that we have appropriate systems in place to monitor performance and to respond where response is needed. So does anyone not support that recommendation? Thank you, that's supported unanimously. And we go to our Executive Director for Public Health, to Mererid, to present her annual report. Diolch yn fawr, Mererid, croeso.
Diolch yn fawr, croeso. So this afternoon, I'm sort of pleased to present my first Director of Public Health annual report. So it's a requirement of the role to provide an independent report as an advocate for the health of the population. And it's a professional statement describing the health of the local communities and sets out some of the key health challenges facing our population based on sound epidemiological sort of evidence. I'm mindful of, the report is a few sort of pages long, so I've just highlighted some key sort of areas, and I'm mindful of time as well. So as we've heard, population of Powys is ageing, and over the last 10 years, you'll see in the first chapter that there's been an increase of 19% in the proportion of the population that's over the age of 65 years, and a reduction in the birth rate. So, but based on population projections, so over the next 15 years, over a third of the population will be aged 65 years and over, with a corresponding decrease in the proportion who are working age, those who work and provide the health and social care. So the current pressures being experienced and described earlier by colleagues in various reports. So the pressures on the experienced on the NHS, healthcare and social care are set to increase over the next 10 years based on current population health projections. So the experience each and every one of us have as we age will be dependent on our health and well-being. And as we live longer, more of the population will be living with chronic conditions that will impact on our quality of life. So in Powys, you'll see within the reports that 2/3 of early deaths, and what we mean by early deaths is deaths below the age of 75 years, are caused by 3 chronic conditions, these being cancer, heart disease and stroke, and respiratory diseases. However, many of these conditions are not inevitable. Many are preventable, provided that there is collective action across the system to promote good health, keep people well, and support people to live healthier and more independent lives. So, and what we mean by prevention is stopping problems from arising in the first place and focus on keeping people healthy. So we know that prevention works, and there is strong evidence for cost effectiveness of acting early across the life course. It's important for us as we go forward to remember that we must give our children the best start in life and healthy ageing to slow the growth in demands on services. So acting for better health will also reduce the pressures on the NHS, healthcare and social care going forwards over the next 5 to 10 years. And within the report, I've set out calls for action for public sector organisations, communities, individuals to collectively take action together to build good health and to stay healthy, to promote healthy and active ageing in our 40s, 50s and 60s, to prevent ill health as we age. And when we do develop chronic conditions, that we provide the support to help people to effectively manage and live well with those conditions as we age in our communities. I'm in the report as well. I have got chapters that describe activities that are going on, and I am grateful to our colleagues and partners across the system who have allowed for their case studies and photos to be shared within the report. And I also like to thank all colleagues who have contributed from the local authority, the Health Board and Public Health Wales and voluntary sector to case studies in the report. Thank you. Diolch yn fawr.
Diolch, Mered. We have a couple of colleagues that would like to comment. Ian, you chaired the PPPH committee, as we acknowledged earlier, and this report, I think, was discussed there. So I'll go firstly to you, and then we'll turn to other colleagues. Thank you, Ian.
Thanks, Carl, and thanks, Mez. I just wanted to just reiterate the comments in PPPH last week. The colleagues really liked the format of this report, the fact that it was clear, that it was an easy read. There was very much transparency as far as the challenges facing us, as Mez has just said, and we particularly liked the bit on responsibility here for the calls to action, which are very, very straightforward, not long words or acronyms, but the challenge and the responsibilities clearly laid out. So we took great assurance from this, and I think the report stands us in great stead in terms of our planning for the future. Thank you, Carl.
Thank you very much. Jen, please.
Yes, thank you. And to completely endorse Ian's comments there, I am a member of PPH committee and just completely endorse Ian's comments. Mez, would love to know a little bit more about how we're going to convert those calls to action into actual action. You say there's going to be a communication plan, that's great. And I'm really keen to make sure that this report informs the policy and strategy of the work that goes on by our colleagues, maybe in the County Council, across the voluntary sector, and indeed across various partnership boards that exist. It's really important that this report brings to life and delivers on that calls to and prompts others to deliver on those calls to action. And I just want to make sure it doesn't sit on a shelf. I want to make sure, because it's such a great piece of work, I want to make sure that this drives the work of others, not just organisations, but actually us as individuals as well, because we all have an individual responsibility to manage and look after our own health. So I'd love to know a little bit more about that. Diolch, Mez.
Okay, diolch, and thank you, colleagues, for the comments. So, yes, as you say, it's important really that it is a collective responsibility across all organisations, individuals, communities. So we are developing a comms plan, and we'd like to, with the invitations of partners really to present elements of the reports that are relevant to different organisations as part of that, and then invite those organisations, to work together. We have in our annual plan, we have put in that we'd like to develop a framework across the life course, preventive actions, and I would very much like to do that jointly with partners for that, but also open as well for any suggestions colleagues that may have.
Thank you. And we go to Ronnie, please.
Thank you, Chair. As others have referenced, this may be your first report, but actually I think it's a very good one. And as others have said, I just find it a very easy read in terms of the clarity of its language. So just to commend that. I have one question and two observations. I've seen some evidence that smoking rates are actually going up in some socioeconomic groups, and I just wondered if you had a particular comment on that. And then just reflecting back to the point Hayley made earlier about the tension in public health terms, about what's in the here and now and what's coming. Correct me if I'm wrong, Hayley, but we have, we have some very eminent people. Professor D.M. Sally Davis, former CMO England, a lady for whom I have a great deal of respect, saying that the problems that antibiotic resistance may cause us may cause COVID to pale into insignificance. And I know that there's work going on around that, but I just want to reference, as it were, the things that are in the near future. And then I just wanted also to say that yesterday I had an epistle I think an epistle is probably the best way of describing it, from CDC in Atlanta about avian flu and the fact that avian flu, and if I remember my epidemiologist lecturers correctly, all flu came originally from birds, but H5N1 has now crossed the species barrier and is actually, the virus is actually present in lactating cattle. Now, that's not a problem in itself. In public health terms, that's of low significance because providing the milk is pasteurized, there's not an issue. But then, of course, some people drink raw milk. But I'm not going into any of that. I'm just saying that that's an example of, we have near challenges, but we have challenges that we have not yet quantified coming down the track. And I think it's important that we're cognizant of all of those. Thank you.
Okay, thank you. Yeah, diolch. Yeah, so I agree with you. I've been sort of watching and reading on the CCG site as well. So just on smoking rates, really, our experience in Powys is that we've continued to see a decline in adult smoking rates and in children as well, which is good news. However, we are mindful really of the impact of cost of living. The evidence will show that actually during hard times, that sometimes adult smoking rates will increase at those times, but it's continuing to decline, and we do have an ambition that we wish to meet a smoke-free Powys by 2030. What we have seen is a escalation in sort of vaping rates in young people, element really, and based on a summit work that I've been involved with nationally, that we think that the drive of some of that is to do with disposable vapes. Evidence shows that, and colourful, etc. And you will be aware from the UK government have recently come out on a consultation around vaping in young people. But I am pleased, and I need to pay credit to partners here in Powys, that we did have a summit event last summer, and we've been actively working to support schools and young people to raise awareness and have put pathways in place for nicotine dependency as well there. But it is an area of concern that we need to have continued action on. Okay.
Thank you. Anything in response, Ronnie? Are you okay?
I'm content. Thank you, Carl.
Thank you. I will come to Hayley. Meredith, I was just wondering from my perspective, you know, we talk about prevention, early help, and so on, and we often talk, don't we, about shift left and shift, you know, and Hayley spoke earlier about the difficulties in investing in upstream stuff because we need to firefight and keep investing in the here and now. I just wondered whether you had a sense of, you know, even if it were little steps, how, you know, what does it feel like from your perspective as to whether we are not, or whether or not we are making progress in the kind of upstream shift left journey?
Okay, sorry, I was struggling with the mute button then. It is a challenge, isn't it, really? And we have to be very, very honest, you know, in terms of the pressures sort of currently and the need to meet healthcare, you know, demands. We have got strong evidence of what works and evidence-based programs. You know, what we need to be looking at really, I would say, is of those population health programs that are currently delivered. I put into the reports last year to make sure we are, you know, maximising those programs, and then looking at it may be better to focus on small numbers of areas and do that well on a population base rather than trying to do a lot of things and then having a narrow focus. So small changes to large numbers of population has a greater effect from a population perspective. And I think that would be my challenge really going forward to partners, to have collective efforts together across the system on one or two areas.
Thank you. So I'll go finally to Hayley for observation and comment, and then we'll come to the recommendation. Thank you, Hayley.
Thank you. Well, Mez, your first report, but from my perspective, just echo the comments that have already been shared, and a huge thanks to you and the team for your work on pulling this together, particularly as others have pointed out that very straightforward approach to a call to action. I had a couple of comments really. I think that the work and the way in which, for example, you've taken forward the work around whole system, the obesity work. You know, you're very strong in the partnership arena around here, and I think how we bring the Director of Public Health annual report, which is a requirement for health boards, but actually making it part of the PSB and RPP architecture formally is something that we can talk through even with the local authority about how do we draw these key reports into the governance architecture for our existing partnerships and key partners. So I think that's something we need to think about, because as you say, the ability to make an impact is based on galvanising action in a collective way across the whole system. And my final comment really, which is really the point you said about evidence-based approaches. I think that there is this dilemma currently, which we need to be very aware of and be checking ourselves as a board at every point around, are we taking short-sighted decisions or the longer term view on some of these issues? And that talks to the principles point that you shared in your report earlier, Carl. But I think the evidence-based approach that is part and parcel of how public health teams work, probably there's some substantial learning for us, for other services around that approach, around how we bring that rigour through more broadly into the way in which we make investment decisions. So I think that's something in particular that struck me when I was reading your report, Mez, but also about the importance of making sure it doesn't sit on the shelf, but that it actually moves into that day-to-day discussions that we have. And I'm very keen to make sure that for relatively small sums of money so far, we've made some really good impact. The question I think I'm really interested in exploring is, what would it take to get a broader impact that would really help us shape the demand? And I think in tie to that, I think we've got to honestly think about the life course around, we talk about what one or two priority areas, but also from a life course perspective, where would we focus our attention? And I think there are inherent tensions in all of that, but I think that's our job in the board to really try and work out, okay, we've got limited resources, but where is it from both the value and impact on population health? Could we be taking slightly different decisions for the future? So I really welcome the independence of this report, so thank you.
Thank you, Hayley. Yeah, so please take all of those comments of appreciation, affirmation, and so on, Mez, for the report. Justly deserved. Do you have any final comments you'd like to make?
Yeah, no, thank you, and thank you for the sort of comments. Really appreciate them, and again, really, it is teamwork, really, and I'd like to thank colleagues who have, produced this report element, really, and welcome further discussion. Thank you.
Great. I've just seen that Kirsty would like to come in, so please do, Kirsty.
Yes, I just wanted to reflect on some good news yesterday from the Child Wales measurement programme. So that's the first time the programme has been able to collect data comprehensively since before the pandemic, and the drop in obesity and overweight rates in Powys, I think is encouraging. So that's some good news yesterday, and demonstrates that progress can be made. Sometimes these problems seem so large you think it can't happen, but there was some very encouraging data out of the Wales measurement programme yesterday for the county.
Really good point to end the item on. I think progress being made and things getting better in some areas. So thank you very much, Mez. We are asked today to receive your report, and recognising that it is a requirement, but I think we have done that fulsomely and with great appreciation. So thank you very much. We go now to Katie, to the Regional Director of Llais. Welcome, Katie. Nice to see you as always. Katie, I know that you're going to present your report and so on, as you normally do. I just wondered as well whether you might have a couple of reflections that you might want to share. Hayley mentioned earlier, we've got some difficult decisions, some big decisions to reflect on over the coming weeks and months, if not years. And you know, you and your organisation have a very important role to play in changes and so on. So and clearly our working relationship with you therefore is going to be well, perhaps it always is important, but it even has increased significance. So, but you know, you may or you may not want to just reflect on the current situation and so on, as well as present your report. But over to you. Thank you.
Diolch yn fawr iawn, Carl. Thank you very much. And before I start, I just want to say how sorry I was to hear the sad news about Tony Thomas. He was quite a character on this board, and I was sorry to hear that. Yeah, I think, well, if I start with that, Carl, I think it's important to say that Hayley and Stephen and Adrian and I are in regular contact, obviously without knowing the specifics of the detail yet. But from our point of view, and also from yours, of course, it's going to be really important to understand the impact on patients across Powys. And, you know, it's without preempting any decision that the board will take, it's likely to have an impact on patients of Powys, whatever that impact is. So our role will be with Hayley and the team, just to make sure that we're looking at the mitigations, which I know you would do anyway, and to be looking at the impact on those communities going forward, and in many cases the longer term impacts. So I suppose just to reassure you, we have another meeting on Friday, so we are in regular contact, and we will be making sure that, you know, from our perspective, due process is followed, but just also to reassure you, I think that it's really important. I've raised this at a national level because it's important that a consistent approach is adopted by Llais across the whole of Wales. Powys isn't unique in where it finds itself, far from it. But that discussion is taking place on Friday morning, so lots of important discussions on Friday. So just to provide that assurance to board that we have made those connections, and undoubtedly there will be difficult decisions and difficult conversations that will need to be had. But I think, as I've said before, we've got the maturity and the professionalism to be able to put the communities and individuals of Powys first. And I guess from our perspective now, we also have a remit with social care, and so we will also be in those discussions asking questions of the local authority with regard to issues that might relate to social care in those discussions going forward. So I hope that I'm happy to take any questions on that. I think going back to the sort of bulk of the report, it's fairly straightforward. I won't be very long. I think it's important just to note to members that we are seeing an increase in the number of complaints. Can I just reassure you that the complaints do not necessarily relate to Powys services because of the commissioning arrangements that we have, but nevertheless the complexity and the number of complaints that we are having is increasing. And even since I wrote this report, which I think was last week, we have a longer waiting list. So we are now, for the first time, certainly since I've been here, we're holding a waiting list for our advocacy service. With regard to Llais Local, we have now completed Llanidloes. We've had our stakeholder group and representatives of the Health Board and the local authority and PAVO were at that meeting, and we agreed a way forward, which I've attached to your papers. We will go back into that community in 6 months' time, probably host some sort of coffee morning or an event just to sort of seek their views and to see whether things have actually made a difference and whether things have changed. We've just finished in Brecon, so we will have our stakeholder meeting on the 14th of June. I hope I'm happy to share the reports we've done with you. They are available on our website, but they do provide some quite sort of insightful evidence. I know, Carl, you were talking about the principles of the board at the beginning, and that evidence base, there's some very interesting data that comes out of those reports. So I think that's probably it. Just on a national level, we are currently consulting on what we're calling the national conversation, which is about the strategy for Llais going forward. So please, members, feel free to engage in that conversation and to share your thoughts and ideas. And I think that's probably it from me, Carl, but I'm happy to take any questions.
Thank you very much. Does anyone want to come in with a question or comment, observation? We go to Hayley and then we'll go to Chris, please.
Thank you, Katie. And again, really busy period for you, and particularly on those local engagement approaches. And I think it's really important that we draw that work in and triangulate all of the information that we have available from that. You specifically mentioned about your increased numbers of complaints, Katie, and I think probably would be really helpful for us to probably pick that up through Claire and her team to understand, is there anything there immediately that we need to act on, and particularly reporting back through to PECs as part of the usual reporting that we do. That worries me a little bit, the numbers increasing, but I'm particularly interested in understanding thematically, you know, are there any patterns or issues within those that we could identify? So if we could pick that up outside, that would be very helpful. And just a final comment for me really is, again, you know, these are difficult times for public sector services, full stop, and I think how we work together on some of these proposals and changes going forward is really important. But again, you know, I know that we can do that in a way which actually holds to the principles, Carl, that you shared right at the beginning of the meeting, which is to make sure that we do that in a way that involves appropriately those who are affected and the public as a whole. So thanks, Katie.
Chair, could I just come in very quickly on that?
Yes.
I'm very happy to do that, Hayley. It could just be that we are out and about far, far more, and our profile is significantly raised because we're working in the way that we're working. But yes, I will definitely pick that up with Claire.
Yeah, thank you. And there's I was going to say that Claire has indicated that she'd be very happy to pick that up and to have that conversation. So thank you, Chris. Over to you.
Thank you, Chair. Thank you, Katie. A really helpful report. And really, Hayley and yourself have answered some of my questions that I'd already picked up, because one is I wanted to know about some of the areas of complaints that were coming in to see whether there was any themes and any learning that not only the health board can learn from, but also with your responsibility now to local authority, of whether the local authority can learn from as well. And I think that transparency and openness, I think, is really helpful. And I was going to say, your increased visibility, just looking at that last report you've put in, shows the number of events that you're doing. I know that I have spoken with members of the public and steered them towards yourselves as a body. And I think it's your increased visibility and people now knowing that you're about helps them to come and raise questions with you on the because everyone did know the community health councils and they knew their members and would then link into those. So I just think this could be cycle in your development and your maturity as an organisation. But that's encouraging, I think. I don't see that as a negative, but I think we do need to learn the lessons coming through so that we can try to actually improve those services going forward for patients. And that on the I did attend your Brecon event for the coffee and cake. The cake was fantastic, so I think that was on the. But Mez might say no, that's adding to my weight gain, so I'll have to watch that one in the future. But it was a really well attended event, and I think credit to the team there. They were so welcoming and I think engaging, so that was really good. Thank you.
Thank you for that feedback, Chris. Thank you very much.
Thank you all, and especially thank you, Katie. And I'm really encouraged to receive the assurances from you and Hayley and others about that strength and maturity of our working relationship, which will be so important as we travel through the future months and so on. So thank you for all your work. Really good to see you again. So we come now to the consent agenda items, under item 5. We've already mentioned these a few times. I won't repeat what I've said, and on the back of what we've already said, I therefore assume that all of these items, that the recommendations associated with them, are approved en bloc. And with that, I'm not aware of any other business, and therefore I assume there is none. And that concludes our business for today. We next meet on the 11th of July. Again, a rhithiol meeting, a virtual meeting, and we look forward to being with everyone again on that occasion. Board members now will go from this meeting into an in-committee, a private meeting, but in order to enable that, I put to you in this public board meeting the required motion, and that is that representatives of the press and other members of the public shall be excluded from the remainder of this meeting, having regard to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest. If you don't support that motion, please indicate. So we do support that motion. We finish this meeting, and can I suggest that we just have a 5-minute break, and we'll begin the in-committee meeting at 2:05. But for today, thank you all very, very much. Thanks to our corporate governance team for all the work that goes into providing, to arranging this, to the many people that have been involved in the preparation and the production of papers, and to everyone for your important contributions to the meeting. So diolch o galon I chi am bob peth, ac mi na i edrych ymlaen at y gweld chi eto cyn bo hir. Diolch.